I really would like to ask you all now to join me in a salute to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. Again, I would like to say apologies for a few technical difficulties on my end. We're ready to roll now. And first of all, I would like to remind people, it's pretty obvious, but we are meeting virtually here as we have been since the beginning of this pandemic emergence. So throughout the meeting, you'll be getting prompts if you're watching either online or on a computer to call a number when it's time to speak on any agenda item. With that, we'll go to the first item of business. Alicia, are there any modifications to the agenda? And
yes,
good morning.
Sure. Good morning, Chair Fennell, members of the board. There is one modification. Director Beck would like to pull item C19 and will return at a later date with that item.
Thank you very much, Alicia. Appreciate that. With that, we'll go to the consent calendar. Are there any motions in that regard?
I'll move that we approve the consent calendar minus C19.
Second.
We have a motion and a second. Any public comment on this item, Ryan?
Yes, Chair Fennell, we do have public comment.
Thank you. So let's go to that. First caller. Hello? Let's see, we've got three. Good. Phone number ending in 5233. Welcome. You're muted still. Your phone is muted. There you go.
Good morning.
Good morning.
Good morning. I am here today to ask this board to direct the public health officer to oppose recertification of Hatcher. In January, the city manager of Eureka, chief of police, police captains, directors of public works, and a group of concerned citizens and business owners met. Yes, ma'am.
I'm sorry. This is an item that's not on the agenda. Right now, we're talking about the consent agenda. At a certain point in the meeting, we will go to items not on the agenda for public comment, and we would love to hear from you at that point, please.
I will be here when you are ready.
Thank you very much. Appreciate that. So are there any other comments or any comments on the consent agenda? Okay, I believe we have another one. This would be ending in 9868.
Good morning, Madam. Good morning, Madam Chairman. This is Vernon Price speaking on item number C15, C18, and C20. The purpose and intent of me speaking on item C15 is that Mrs. Montgomery is the lady of choice of this wonderful pay increase while the senior program manager or person is out on leave. Thank you so much for choosing Miss Montgomery. She has a very heart for the people and compassion for her community. Thank you so much for allowing her the opportunity for the supervisorial role. Item number C18, I would like to speak on the behalf of the home key. This is a great, great opportunity to increase not just the services that are rendered to our unhoused citizens in our community, but it's also improving the quality of life and building a stronger community that we all reside in. And I would like to give a personal recommendation for C20, Mr. Tim Doty, for the Behavioral Health Board. This gentleman has such a compassion for people with mental illness, and we would love to move forward with this gentleman on our board, that we can continue to move forward together in improving the quality of life and building a stronger community. Thank you so much for your time. and your opportunity and the opportunity to speak on these 3 items. And thank you so much. Have a beautiful day.
Thank you, Vernon. You too. Next speaker, again, if you have any items on the consent agenda you'd like to address. Good. See, it would be number.
Hello, Estelle.
Good morning.
Good morning. It's back from Mexico, 30 days.
Good morning, Ken.
Good morning. I'd like to make comment on item 2, your support of the Arcata Fire District. I wanted to start out by saying the Humboldt County Taxpayers League, and I haven't had time to see articles and things, has been referred to as a small, ineffective organization. We're small, but we're mighty. And so I want to let you know why we're in opposition, and we are in favor of and have supported Trinidad's renewal of their tax, Fortuna's renewal of their tax. We did not make opposition. Virginia, are you surprised if you're there that we did not make opposition to Eureka's tax? We're leaving that up to the voters. They did, I believe, I have communication with the president of the organization, but they did put a sunset in there, which we request they do. We're not going to get involved in that one. The only tax of any consequence that we feel is inappropriate is the Arcata Fire District tax. So I have some why questions for you. So Steve Madrone in West Haven, the Blackberry Pie District out there, Supervisor Madrone, how many volunteer fire department people do they have there that are certified to respond to a fire? Rex and Estelle, your volunteer fire departments, how many people are certified to respond to a fire? I mean, how many people can actually go and do this in all of these volunteer fire departments? Correct me if I'm wrong. You've probably done the research since you're supporting this, but the information that I was provided at Arcata only has 4. What is the population of this district where these volunteer, and why don't we have a volunteer fire department that can help out? If someone was suspicious, they would say you have a very powerful union fire department there, and they don't want competition. So I have some other why questions for you. Why, when this is put on the ballot initiative here, they list total annual charges, but they only include one of the 2 taxes? Virginia, why, and I believe you can do the math if you haven't already, why are they paying, I think, 3 times as much as Humboldt Bay Fire, and it's at least twice as much as Humboldt Bay Fire charges for the same services? Let's see, in the letter from the thing, and it's very disingenuous, I said, from the fire department, and I like Justin McDonald, the new state-of-the-art fire station in Mckinleyville would remain open only part of time and without full-time firefighter coverage, putting Mckinleyville and large community at risk. Why would they say this? My understanding is there's one fire department facility out there by the hospital which responds to less than 10% of the call. So why was Mckinleyville, basically, and I just bullied into assuming that this would have to happen? It totally doesn't need to happen. I mean, this is ridiculous. Humboldt County Taxpayer League, my understanding is, supported the prior tax because it was appropriate. This one does not. It's put on the ballot. Oh, why do they say they need $500,000 during the next few years, and they're putting a ballot measure on there for $2.2 million when everybody else is taking a haircut? You may support this letter. We will continue not to support this. We would have been willing to support something for to find the $500,000, but not for this, especially during this time. So thank you for my opportunity. If you want to correct anything I've said as being wrong, please feel free to do. You have unlimited time to do so. Otherwise, I'm going to assume the statements that I've made are correct, and it should have some impact on your decision. Thank you.
Thank you, Kent. It looks as if we have more speakers. So let's go to number 3053. Welcome.
Hello. Good morning. Thomas Mulder. Can you hear me?
Yes, we can, Thomas.
Hi, I'm calling on item 30C31, the cash handling policy. I was reading at the very top of it, cash handling, coins and currency are also known as legal tender. I think it'd be good to modify your cash handling policy, since coins and currency are legal tender, to include things about late fees. If you have during this pandemic if you have offices that are closed and people have bills that are due and they want to pay in cash, legal tender, that you guys take that into consideration and not charge late fees or additional fines if that is how the person is trying to pay their debt to the county for whatever reasons that was. I think it's something that has come into play during property taxes. And as that is legal tender, I don't think anyone should be discriminated upon for trying to pay in legal tender. Thank you for the opportunity to speak.
Thank you, Thomas. And I believe we have one more, I think number 2025. Good morning.
Good morning, Chair Fennell and members of the board. This is Maya Conrad from the McKinleyville Municipal Advisory Committee. And I want to thank you for putting item number 2 on the consent calendar this morning. The McMac requested that you or urged you to support a resolution for the upcoming Arcata Fire Department's funding ballot measure for this November election. As a very large unincorporated community, McKinleyville relies on the Arcata Fire Department services to keep our community safe. Without the passage of their upcoming ballot measure, our new state-of-the-art fire station is only open part of the time, and we have over 15,000 residents to keep safe. So if we don't have full-time firefighter coverage in McKinleyville, it puts our large community at risk. So by supporting this ballot measure, the Board of Supervisors is sending a clear message about how vital this service is to our community. So I appreciate your support of this measure. Thank you.
Thank you, Maya. I believe that's all the calls, Ryan. Is that correct?
You are correct, Chair Fennell. That concludes the comment on the consent calendar.
Thank you very much. Appreciate that. Bring it back to the board. Supervisor Bass.
Thank you, Madam Chair. I just wanted to echo what Vernon said about Tim Doty. He was a great member of the Behavioral Health Board. When I was there and when he left, it was a sad time. So I'm glad to have him back. He's a person who really cares. So I was really happy to see that on our agenda. Good.
Yeah, thank you. Supervisor Bohn? Oh, okay. Yeah, saw your mic off. Great. All right. So with that, we will take a roll call on the consent calendar, please, Ryan.
Thank you, Chair Fennell. We'll start with Supervisor Bohn.
Yep.
Supervisor Bass.
Yes.
Supervisor Wilson.
Yes.
Supervisor Madrone.
Yes.
And Supervisor Fennell.
Yes.
Thank you. Passes 5-0.
Thank you very much, Ryan. Now we'll go to our time certain set, and I know we're a little late on this, but we'll go to an update on the pandemic emergency, the COVID emergency. We'll hear from Dr. Frankovich, Director Stevens, and Sheriff Hansel. Good morning and welcome, and go first to Dr. Frankovich.
Morning. Thank you, Supervisor Fennell. Feels like it's been a while.
Yes, it has.
It has. So just quickly to run through sort of some of our local numbers and issues to update the board. Again, I always feel badly about starting with case counts, but I'm not sure how else to orient us to this pandemic. Globally, we are at 22 million cases and about 750,000 deaths related to COVID. In the US at 5.5 million, 172,000 deaths, and in California, we're at 628,000 cases, 11,000 deaths. I would say the positive news that we hear this week from the state is the decreasing hospitalization and deaths in California, that decreasing trend, which is really important. And it may be that California is starting to come down off its first really large wave of COVID. And so there is no small hope on our part that if, since we've been able to hold on as well as we have through this first wave, if we can continue to do so, whether we may enjoy a little period of slower activity at some point here, but we shall see. The governor announced yesterday that 42 counties are now on the monitoring list in California, including our neighbor to the south, Mendocino. And again, you know, I feel like we've done incredibly well here. I attribute that to what I think are the majority of our residents who are really working hard on trying to follow prevention guidelines, and also our lab, which has been amazing. I think of our lab, and I don't know, it was probably 2-3 weeks ago before they'd even ramped up further, when they were running more specimens in a week than they ran per year of PCR specimens. So, I mean, their capacity has increased dramatically to keep up with testing. And then, of course, the rest of our CD team and EOC. So they put their heart and souls into building capacity here, and I think it shows in our numbers. That being said, you know, certainly our current trends are worrisome. We have seen a marked increase in activity in COVID overall, like the rest of the state, in past weeks. So right now, our cases per 100,000, this is one of the measurements that goes to our being on the county monitoring list. Our cases per 100,000 are currently at about 57 per 100,000. On July 10th, they were about 28. So we've, you know, significantly increased that. 100 per 100,000 would get us on the county monitoring list. So, you know, we're certainly watching that carefully. Our positivity rate is still actually looking good at 3.4%. Otherwise, we would already be on the list. Greater than 8% with our case count would put us on the list. Our cases increased about 32% in the past week. Interestingly, and reflective of what we've seen in the country, more than 40% of our cases are under the age of 30. 75% of them are under the age of 50. Which is why our hospitalizations are relatively low here still. And of course, the concern we've talked about in the past is that as you increase the amount of virus circulating in the community as a whole, eventually it starts to impact the higher risk folks and older folks who may actually be doing more sheltering in place. But at some point they become impacted as well, and hospitalizations and such increase, as well as just when the overall case numbers get bigger. You start to see those more in even younger folks. Our doubling time right now is about 41 days. Just to give you perspective, at the beginning of this, early on in the pandemic, in our cases, it was over 250, I believe, days. So it's definitely decreased substantially. So the couple things that we're looking at, again, with all of this, our goal was not to have zero transmission. It was just to kind of have, you know, to control transmission. So right now, our biggest issue is really testing. We have built our capacity internally at the Humboldt County Lab. We acquired some new equipment. We're bringing on some additional staffing for processing. And our goal is 300 per day. We hit 200 the other day. And with this new equipment, we think we can get to 300. So just by comparison, again, at the beginning of the pandemic, we were testing 30 to 40 per day. So we've dramatically increased that, and kudos to our lab. We also know that the Optum site is currently contracted with, we just found out in the last couple of weeks that it's currently contracted through September by the state. We have used this opportunity to try and build some additional testing capacity. We initially thought to set up local collection and use a commercial lab, and that we are still sort of making sure those pieces are in place in case we need it. But an opportunity came up through the state to potentially get high throughput equipment from a company with reagent provided by the state, and that doesn't appear like it would have a supply chain issue. So we are working across our county with NDEL Norte, the UROC, and HUPA, UIHS, and HSU as well has come on board, and we are to hopefully assist down the road at some point. And we're looking to build sort of a regional testing capacity that could provide us at least of an additional 500 tests per day, 400 to 500. So we would have really excellent and robust capacity with the turnaround time that would look like our Humboldt County Public Health Lab, 48 to 72 hours, which would be outstanding. So we think it would best position us going forward. We are now, normally this equipment was available to public health labs directly for on-site. Our site is too small to accommodate this. And so we are looking at working with our partners to place, at UAHS, to place it off-site, and we need to get the state approval for that. We are hopeful that with that approval, and we should hear this week, that we could have the equipment arriving and look at a start date that could be early October. So that's what we're shooting for right now. So right now we're contending with, as everyone is probably aware, with cases in Hoopa. There are approximately 41 cases since early in the month that have occurred there. And so we've been working very closely, providing contact investigation and working collaboratively with Dr. Eva Smith and folks there to work on trying to contain transmission. We also have had a skilled nursing facility associated healthcare worker, 2 cases with no patients involved at this time, and we are working very closely with them on internal measures as well as testing so that we can hopefully contain this as well. We also have some clusters simmering in agricultural sectors as well. So those are some of the issues in terms of our testing right now. So the other news, we do have very limited school opening to on-site instruction. Primarily, it has been the Fortuna High School District at this time that, and some other spots, for instance, some services in Eureka and Arcata will be doing some limited with, I believe, with some high-risk students. But essentially, many of the schools have chosen to wait a bit and see what the lay of the land is. And we'll be still continuing conversations with them. And some will probably persist with distance learning for a while. So that we are supporting the schools in the model that they can feel they can operate most safely. And in the facility they have and with the staffing they have. And so we'll continue to do so. The other big thing would be then our college and universities. So Humboldt State University and College of the Redwoods. So, you know, I think you're probably aware that we looked, you know, we've talked both with HSU, had concerns about our current situation for beginning on-site instruction and return of kids to dorms. Unfortunately, you know, I think for the college and university purposes as well as ours, the higher education document, guidance document from the state came out last Friday, and I think it was on the 7th. And so there was not a lot of lead time from that document, although I think both entities have done, you know, put in a lot of time on planning and trying to minimize risk for on-campus housing, that type of thing. All of that being said, obviously the situation has been really fluid with COVID, and there really was no question in my mind that we would be better positioned to manage in October when we had really robust testing access without a strain, and to be able to do the kind of testing we wanted both for students arriving to congregate settings as well as to be able to address outbreaks and such that might occur. However, when I met with President Jackson, it was clear that from their end, they would not be able to delay, and they were planning on proceeding. So we basically began planning what we could do to support them and minimize impacts. So pulling together resources, we had actually reached out to the Richmond State Lab to see if they could take any overflow if needed, and they can give some additional capacity up to 100 specimens per day. The problem with that for us is that right now their process is to accept specimens directly from public health, which means public health packaging, doing all the data entry and such, and management of those, both sending out and returning. And so it does add a substantial workload to the lab rather than being outside the lab and taking that burden off. So to date, we've been shouldering the testing for arriving students, and we'll do the best we can to do some ongoing testing. We were aiming to test the students coming into the dorm setting 3 times in the course of that first 14 days. We may end up doing it twice, but I think getting that testing done as best we can is helpful. Mainly
excuse me,
yeah.
Excuse me, Dr. Frankovich, Supervisor Bass has her hands
Oh,
up.
I'm sorry, couldn't see.
I can wait till she's done. I have a couple questions. Sorry.
Oh, okay, good. Sorry, go ahead. I'm sorry.
Oh, that's okay. I'm sorry, I just wasn't even watching there. So anyway, we're doing that. And again, the concern is really, it just goes to the thing we've been saying all along, which is, travel has been a big driver. Movement of people across the state has been a big driver of transmission and gatherings, that sort of thing. I've been harping on this for months here. And so we're just talking about that sort of in a larger form. We're bringing students from potential with higher areas of the state with higher risk of transmission. We have some places in the state where their case rates are over, Merced, I think, is over 500 per 100,000. So it just, it's the kind of thing that we look at and go, if you're bringing friends and family here, it introduces risk. So we're just looking at how to minimize that and work with the university to both do testing and to do contact tracing. The university has also set up a connection with a commercial lab. We are doing as much as we can on site because we're probably faster, but we will also, I'm sure, have them using that as well. College of the Redwoods is a much different situation because of the fact that they are housing only 48 students in a dorm. And I believe initially it was 7 students were going to be from out of the area. Now it's, I think, 11, but it's obviously much smaller. The testing demands are much smaller and easier to manage. So it's really a logistics issue there that's more manageable. So again, at this point, we are just working to, partner and provide the support that we can in this instance. And we know that this is a gap until likely October, when we will be better situated and the testing strain will not be as significant due to the increased capacity. And I think that's all I was going to mention.
Thank you, Doctor. So we will go now to Supervisor Bass.
Thank you, Madam Chair. And I have a few questions, a couple about the university and then some tribal. I don't know why I keep finding all the articles on university students, going wild partying. Of course, those are the only ones that get out, right? But I'm hoping they do have some plans on how to kind of manage some of the student activities. I don't know what other places are doing, but I certainly would hate to see very large gatherings. And I would think, it's going to be tough to restrict that. So, that's where my concerns mostly were with the university. But I was curious, because I know some places when you travel, you have to show up there with a negative COVID test that had been taken within X number of days of your arrival. Was there any way that we could have at least had people have a COVID test, within 5 days? So at least the first test is kind of done. So that was, and I don't know if that's realistic. And then I was on the phone yesterday with some others and Dr. Galley from the state. And I asked if they're, what they're doing with tribal entities as far as coordinating when things, cases come along. And it was interesting because he goes, oh, we're really keeping track of the casinos and, that's where our worry is. And, I had to tell him that, well, we have an outbreak and we don't have a casino, this one. And he was absolutely unaware. And so you might hear from him. But I think that the point is, maybe there's some more resources that the state will offer, unless he just was out of the loop. So
yeah,
just want.
To that point, Supervisor Bass, we have had a call with OES and CDPH about HUPA and what resources are out there and available. They actually will be able to supply us with some additional contact tracers in our area, which will be helpful. It's just getting them onboarded. We have to have an MOU and processes and stuff to do that, but we will get some additional assistance with that. We actually have a number of investigators and contact tracers working with them right now, but the state is aware of HUPA and the situation there. But Dr. Galley may not be at this point. In terms of your other question, yeah, and he's got a big state. In terms of pre-testing, some places, I'm sure, yeah, like as you mentioned, some colleges were having people pre-test before they came. Some, there are pros and cons to that. One of the problems is, of course, if you get tested 5 or 7 days before you come, it only tells you whether you were negative 5 or 7 days before you left. And so that's why, there is debate. I think certainly testing kids when they arrive is helpful to identify people just walking in the door, because we know kids typically can be asymptomatic. They feel fine and they're loaded with virus. So if we can sort of catch that at the gate, it's helpful. Particularly, again, when you're bringing kids into congregated settings where transmission just can happen much more easily. To your point about activities of the students, you're right. I mean, I don't think we have any illusions that students will be sitting in their dorm room for 2 weeks on arrival and not leaving it. However, I do know, certainly the students have received information about that. The university's plan was actually to have students essentially quarantine for 2 weeks on arrival before classes started. And so my hope is that they will embrace that to some extent and try and limit their interactions. And certainly the message has been given out about the need for facial coverings and such as well. So,
All right. So any other questions from supervisors on this item? Okay, I did have one thought in terms of that. I know that there was concern in Fortuna, and then Fortuna schools responded to that by making sure the kids knew that when they got out of school, they couldn't just congregate all over, and that seems to have been extremely helpful. Obviously, it's a little bit different with the university environment, but has Mr. Jackson talked at all about university police helping in that regard?
I don't know if they're going to be doing reminders for students about that. Certainly he could consider that. Just again, across the state, facial coverings are required. So most students would not be unfamiliar with that idea, but obviously that has been taken up differently in different parts of the state. So I'm certain as students are coming into businesses and things like that in town, they'll see the notifications. And again, I'm pretty certain that the students have received information about that need just in the things sent out by campus. I mean, I think, again, it's not optimal timing by a long shot. But we will, we'll do the best we can, and we'll remind them.
Okay, Supervisor Wilson and then Supervisor Bohn.
Well, I didn't have my hand up, but if
that's
Supervisor. I kind of wanted to wait for public comment because I really wanted to hear what the public had to say.
Supervisor Bohn.
With the outbreak in Hoopa, I know they're like over 50% of our cases this month alone, and you've been talking about everything jumping up, and I know they're like 13% of our overall cases. So I know with the 57 per 100,000, would there be an opportunity, since that seems to be a cluster in a remote area at one time, it still is, are we looking at, before we go into jump right into a phase, so you talked about phase 3 or another shutdown, would we be able to argue, since they are set up with their own health officials, their own doctor leading the charge up there and stuff like that, that they wouldn't be, lumped in with our numbers as much? I mean, I appreciate all we're doing for them, and we should be doing, because they are, but I'm just saying, would that help us at all? Or, I mean, before we go into the economics of this thing are already brutal enough, and then having other people having to shut down again, would there be any relief available from the state by saying, hey, this is a extreme cluster? Because like I said, they're 2% of our population, 2.5% of our population, but they're 50% of our cases here this month. And we talk about the rapid increase this month. It's just a thought people have been asking.
Yeah, Supervisor Bohn, I would say probably not, in the sense that the state has taken into account, for instance, prison populations when they do those calculations, just in terms of if your county happens to have a large prison, whether those numbers should be counted in like your hospitalizations and in your county monitoring. But, the Hoopa area is, the residents there and even though the location is relatively remote, there is a lot of interaction across the community with residents of Hoopa. And in fact, we have seen additional cases outside Hoopa that may be related. And so I think those cases would probably just be counted the same as all residents in our totals. And again, the county monitoring list would mean those things like places of worship moving to outdoors, hair salons, personal services outdoors, those types of things. It would be the next stage, not a complete shutdown. But obviously, we've been working really hard to stay off that list.
Thank you.
Thank you. And first, before I go to public comment, is there any input from the sheriff or Director Stevens on this item?
Wanted to say just one thing. One is that EOC is there to support the ongoing effort. We continually work on testing. We have test sites, McKinleyville. We have different remote test sites that we're pushing forward. Public information is the key. So again, if you have questions, call 441-5000, get a hold of our JIC, and we can answer those questions, concerns, those kind of things, as well as visiting the website, humboldtgov.org, has a lot of information there. But we're busy working on business compliance, certifications, supporting contact tracing, supporting public health, and doing what we can with all this. So far, everything's going extremely well. Our staffing is getting the point where we're getting pulled in different directions, but so far everything is going as well as possible.
Thank you, Sheriff. Director Stevens.
Yes. Hi. You were breaking up, so I didn't know if you were finished. Yes, I just wanted to add the state, the OptumServe site that we have, like Dr. Frankovich mentioned, their contract ending at the end of September. I just wanted to add that the state is doing a request for proposals that should be out in probably the next week. And they're seeking input from counties, from health jurisdictions. And so we've been providing input on kind of what works and what hasn't been working and what we would like to see differently if they were to continue these, but we're planning as if they're not going to be available to us. And so that's what we have to do because there have been such challenges with it. And so we'll see if the state will continue to provide us something, but that is something that we're looking into, is mobile testing for locally as well. As the partnerships that we're looking into, but how can we do more collection ourselves as public health and more local testing in that way too. So just want to add that.
Thank you, Michelle. Okay, let's go to public comment. Is there any public comment on this item? I believe we may have one hand up there.
Estelle, Kent Stawatsky, can you hear me?
Yes, good morning, Kent, we do.
Good morning. So I spent 30 days in Mexico, and I'm going to make one statement. I'll make it later, but you guys are in hell and I'm the devil. I heard that on a movie once, and I liked it. So here's a little bit of how incompetent the state of California and Humboldt County is, and it's grossly negligent compared to a third world country like Mexico. I was going into Home Depot. They only let so many people in down there. You had your temperature taken. I did not have my temperature taken at all as soon as I left Mexico in the airports. When I got here, all we have when we get here is above the baggage thing. And if you're not picking up your baggage, I don't think you even see it. A few little things you're supposed to do. It's ridiculous. To get on a plane, any plane in Mexico, you have to fill out a form. Very simple little form. And the date, the airline you're on, the airline number, your seat number, your name, your contact information, phone number, email, where you've been in the last 14 days. Mexico, Hermosillo. Have you been in contact with anybody in COVID-19 in the last 14 days? No. Have you had a temperature of 38? Of course, that's not our normal temperature, but there you go. No. You have frequent coughing and sneezing? No. Suffer from discomfort, headaches, and any other acute health problems? No. Breathing difficulty? And then you have to sign that form. They can contact you and to fly in, or any student coming in, to go, anybody coming into Humboldt County should fill out this stupid little form, and they also should have their temperature taken. And it's really easy for Humboldt State. I was extremely irritated to see that our health officer would potentially put our nursing program at jeopardy at Humboldt State after all we've done. This is not all that difficult. This is very easy policies that should be worked out in partnership with Humboldt State. They'd be a great partner. If they have a student who's not wearing a mask or not social distancing, they get number one, they get a warning. Number two, they get a warning. Number three, they're expelled. On United Airlines, allegedly, their policy is if you're not wearing your mask, you will be precluded from flying on United. And they didn't say for how long. Unfortunately, they weren't enforcing it. The person one seat over from me, and I believe it would be seat 38D. I was in F, one seat between us. She was to wear a mask the whole time, required to do so, and it never left her chin. But allegedly, she was supposed to be 86th out of United for that. Of course, the stewardesses walked up and down, and they just chose not to. I think she thought she was too cute to wear a mask. Had the same thing leaving here. A gal there was doing her selfies, and she walked up the gangplank without her mask on. And one of the ladies totally came and glued by me. And I said, no, she's just too cute to wear a mask. So it's responsibility and it's enforcement. You don't have any enforcement here. If you start expelling people from Humboldt, if they don't comply, if they start partying, you expel them. These people who want to be serious and want an education have a right to be here. They have a right to go to class. You're ruining people's lives. And I don't know, making all this money and this overtime. Like I say, you're in hell and I'm the devil, and people's lives are going to be made extremely difficult because you're going to have to deal with me, Miss Franco, whatever, on a regular meeting basis. Thank you for my time, Estelle.
Thank you. Gone well over 3 minutes there. And I believe we do have other callers. Hi, caller, you're next.
Yeah,
Yep.
Good morning, everyone. This is Uriah Driscoll. I'd like to make a recommendation. I tried to the last time I was on the meeting and I got cut off, but it would seem to me that distributing thermometers, making sure all families, everyone had a thermometer that they could check their temperature at a certain time of the day and make a recording of that would be a simple, very non-intrusive thing that could be done by families each day in the morning before they went to school or went to work. And that would just help people understand and put something in their own hands. The mask wearing issue, obviously that's pretty confusing. Are there going to be fines? Are people going to be thrown in jail? Are we defunding the police? You know, all this stuff is very, very confusing. But I think one thing that we're going to have to do is realize that the cat is out of the bag, that virus is here. It's been here for 6, 8, 10 months, whatever it's been, and that we've got to learn to live with it. And to live with it means having an economy, having school, having have people being able to operate and function as a society. So I think that this, you know, the contract tracing, while that may have been effective initially, I'm not even sure that is a viable use of our limited resources. But, you know, putting thermometers, getting, you know, masks and people in especially indoors is very critical. That's all I've got to say for right now. Thank you very much.
Thank you, Uri. I believe we have Another caller? Welcome, caller.
Hello, can you hear me?
Yes, we can.
Hi, this is Thomas Mulder again. Good morning. I'm just calling. I've voiced many concerns and frustrations over the months of this pandemic and lockdown. I would like to see a little more results with all this overtime that we're paying. It would be nice to hear. I did lose the call for a little bit, but I didn't hear anything discussed about the false positives. There was, I think, 3 or something like that. It'd be nice for the community to know if there are more potential false positives out there, as that's been something that's been stated by multiple people, that the testing is possibly off. Also, it would be nice to know the turnaround time for setting up an appointment for testing. I didn't hear that part. I've heard from people that talked about getting testing that it was over a week wait for them to get in for a test. So they basically thought it was pointless because by the time they got the test and the test results back, they would have already been cleared of it. So it'd be nice to hear, with all this overtime that we're paying, that we're getting that kind of data. Also, I did not hear much talked about the social emotional aspect of the youth and the children. I think it would be very, very important at some point in time we start talking about the social emotional outfall of this, getting playgrounds and different things for people to be able to socially distance and be active outside. Winter is coming, so it'd be nice for people to get as much outside activities as possible. And it's just, I would like to see more. We're paying a lot of money in overtime. I would like to see more. Thank you for the opportunity to speak.
Thank you. I believe that's all the public comment right now. Is that correct, Ryan?
Correct. That concludes public comment for this item.
Thank you. So bringing it back to the board, any further discussion on this item? Supervisor Wilson.
Thank you. I really appreciate all of the work that's being done. And I actually, it's interesting that there was a comment that, with all of that work being done, someone's expecting more. And I think part of what we don't see is the numbers that would happen if people weren't doing the work, right? And so I really appreciate and I want to put out there that I do think there's an extreme amount of dedication from the county staff and from all of our institutions related to trying to keep us safe. One of the things I do know, I want to acknowledge that there has been some, sort of public disagreements related to university and what's happening there. But what I really want to focus on that is I just want to make sure that in those discussions, we're not othering students and a population of really what are adults and residents, and most of which are residents for long periods of time, if not full time, in this community. And I want to make sure that we're doing our best to be as helpful as we can in that regard, but at the same time, really helping to the university and other institutions, all of our businesses and everybody being accountable and doing the best that they can to address the issues. And I think we're getting there. I'm looking forward to these partnerships, but just focusing again, students are not others. They are residents and they are part of our community, many of which grew up here, many of which are here full-time, and many of which will live here for the rest of their adulthood, if not a significant part of that. And we need to be understanding and in many ways welcoming to humans that are many of which need housing. And this is part of what that is. And also understand we are not the only university community that has this experience. And I want to put out that many universities that do not have any on-site instruction are having same conversations there too. So we're not alone in this. And I do believe actually probably because of the focus that we're putting on it in our community, that we're probably one of the better served communities in this regard, albeit still it is an anxiety-ridden situation nonetheless. And so hopefully we can get moving and do our very best to keep our numbers down and be respectful of all of our residents.
Thank you, Supervisor Wilson. Supervisor Bohn.
I want to applaud Supervisor Wilson for that statement. I think the college is doing everything they can, working with their UC system, and it looks like actually working with our staff. And I appreciate that collaboration. And I think it couldn't have been said better. They're no different than our children or anything else. They're out, doing what they have to do to get an education. And as Supervisor Wilson said, quite a few of them stay here. They're productive members of our community, and the people making the decisions up at the college, I think, are fully aware of what they're doing because they're living within those ranks of those people. They're there every day as these students come in, meeting them. And these decisions aren't being made from afar. They're being made from people that live here in Humboldt County too. So hopefully, as Supervisor Wilson said, we can look at this as all one big package and all work towards a solution and keep moving forward, because as has been stated, this thing is not going away. We're trying to get a handle on it. I think we're getting a better handle on it sometime than is portrayed. But as we go, Mendocino makes you nervous. A lot of things make you nervous, and thousands of tourists every weekend make you nervous. But I appreciate Mr. Wilson's remarks on the university.
Thank you, Supervisor Bohn. Supervisor Bass.
Thank you, Madam Chair. And I'm sorry, Supervisor Wilson, if you thought I was othering. I just think it's when any large group of people get together, whether it's a conference and you haven't seen each other for a while, there's just a tendency, and it's admittedly a large group. So it's not that just because it's students. I've seen a lot of adults get together and probably do some wilder parties than what any of these kids would think of. So I apologize if you thought I was saying that. I just think we need to help them understand, and just like we do everybody else. But what I wanted to just mention, I heard, people talking about, really there was some real frustration about that we do things different than Mexico. And, but I know I'm looking at places like New Zealand. They went 102 days, whatever, without any transmission. And now, in a few days, they've got 98, and they're basically shutting the place down again, which they're taking a pretty bold step, and they did it early. And I don't know what all the background is on that, but, I don't want to see us have to become, go to that extent. So hopefully we can keep things under control. And I know Spain is also, some areas have been shut down now, so that, like, if you're going to Germany from Spain, you have to be quarantined in your house for 2 weeks, and you have to get tested, and they don't want to let you come back. So I just, I know it's not pleasant. I don't want us to shut things down any further. I was glad that we were not on the list, that we didn't get added. But I also see what's going on elsewhere, and it's, I know you get a lot of flack, but it's not an easy job, and I would not want it. And we get a lot of flack because we're on, we put ourselves in this position, and that's fine. But so I appreciate all you're doing and all Michelle's doing, and the sheriff. It's not perfect. I don't think anyone knows what perfect is right now, and I don't think there is perfect. So we go another week and hope that it just gets better and stops being at such a high level of transmission, because that does concern me.
Thank you, Supervisor Bass. I want to say also that I think that, what it's all about is recognizing the situation and taking the appropriate precautions. And so I think that, if you look at New York, saying people coming from certain areas which have a high count must be tested, must be quarantined, etc. Those are the models that are being looked at throughout not only the world outside, but also this nation. But I think that what I see more than anything is everybody working together. And I've seen that with the health department and the Fortuna Union high school district. It's been really wonderful to see that happening. Also now here, as we move forward with HSU, I think there's a little bit of a difference, and I'm not afraid to call it out, is that some of the students at HSU do come from areas that have are on the monitoring list. So it's important to recognize that and to take the precautions that need to be taken. So I think everybody working together on this, we're actually doing a pretty darn good job, and appreciate all of your work on that. And I did want to ask the sheriff if he's still there. There was, discussions of people getting into unpleasant situations or complaints coming in about various schools, etc. And I just wondered, I do understand that the Joint Information Center now has a little bit more of a refined approach, that there's a certain number of times there can be a complaint about an area before you take further steps. Can you explain that, please, Sheriff?
Absolutely. So what we're working on right now is on the business compliance side, is working with code enforcement to solidify the business complaint process. So when someone does have a complaint about a business operating outside of the public health guidance, then we can actually, document through a phone call and a verbal warning, essentially, and then go about and do a more formalized letter with basically just really determined language that, this will affect your compliance certification. And before it's turned over to maybe a third complaint, then code enforcement gets involved, sees the violation occur, and then at that point in time, a citation is issued, as well as a chance to remediate that citation, through an appeal process. The ultimate goal here is to get people in compliance. That is the ultimate goal. But if they do not go into compliance, then fines will start occurring. And then first offense, second offense, it could get pretty expensive for businesses to act outside of our public health officer's orders. So again, we want, so far the businesses are doing really, really well overall. The community is doing well. We want to encourage that. But for those people that aren't, doing it right, there will be some consequences moving forward.
Thank you, Sheriff. Any further discussion on this item? Supervisor Wilson?
Yeah, just for the record, my discussion related to cautioning our community about othering folks in our community did not come from the comments of Supervisor Bass. So just to be absolutely clear about that, I want to, it's just that we do have, even in our terminology, and I will say, I think that our staff is doing a huge job, and I do completely understand in being immersed in this and the anxieties and the work that that they're having to deal with, and I want to be very supportive of our public health staff. But still, even in the terminology we use, and I have to correct myself all the time, we use the term often kids and for students, and these are adults, and they may be young adults and those sorts of things. But we really need to, if we're going to have a respectful understanding and working with people, which is what again we have to be that in that same way. And I fall into that all the time because I have a child myself who's in college, who's not a child, who's an adult, right? And I still use those terms often, and I have to be very aware of that, and I think we all do. And also really understanding that we're trying very hard to be a welcoming community in terms of, and again, we're in terms of the demographics of our community is changing, and student population is acutely aware of how they are perceived within our community, and I want to make sure that our reputation is not or is a good one in terms of being positive in the experiences that our student population has. Because again, I want to make a community that people want to stay and live and be here for for the duration. And this is an important time, and this is how we react, and what we do, will be part of that narrative across the state. And so I want to make sure that we come out on the positive side of that. And again, thank you to our staff for their diligence and working hard.
Thank you, Supervisor Wilson. Supervisor Madrone?
Thank you, Madam Chair. I just wanted to thank Dr. Frankovich, Director Stevens, Sheriff Hansel, all the businesses, all the members of our community that have been distancing and masking. This is not easy. This is going on for a long time, and we're not through it. And I know it requires a tremendous amount of patience. So I just wanted to briefly say thank you to all the folks that are working so hard to keep us all safe. It's not easy, but I really appreciate your hard work. So thank you very much.
Thank you, Supervisor Madrone. And I want to echo that, as well as say thank you to all the frontline people that are out there, that are wearing masks every day, all day during their jobs, making sure that we're taken care of. And I have one other question. I'm sorry, because we're going a little long. But one of the things that I have heard in the community, we have an example here now of a whole bunch of schools that are doing distance learning, but we have at least one school or a number of schools in the district in Fortuna that are actually doing in person. And what I'm hearing now from people is they're going to be looking at that, because it is very difficult to be a parent, especially in a household where they're both working, to do the homeschooling, to do the distance learning. And is there any help for them? I mean, in terms of childcare and tutoring, is there anything coming from the state that recognizes that they're taking on extra burden just to keep us all safe, or based on the school district's decisions?
Well, I guess Supervisor Fennell, I'm not quite sure of the question, but I mean, the schools are, for the distance learning, the schools are tasked with, I believe from the state, developing kind of a more robust approach to distance learning. So kids, even at home, should be engaged. That being said, we do know there are families challenged with, connections to internet and to, being able to support distance learning at home. So, of course, that's a concern. As a pediatrician, I particularly have concern about young children. I think it's particularly difficult and challenging to do distance learning with very young children. And so, COVID has just made this all really difficult. And I completely understand that for many of the schools, the logistics of trying to adhere to all of the requirements to be able to do this on site is just, for some, it's just not possible because of their particular situation. But we've, in public health, been supportive of the schools who do want to open, trying to, help with responding to their plans. For all the schools, actually, we have a nurse here who's been working with the schools on trying to answer questions and provide technical assistance as they move along. And, we'll continue to do so. If we end up on the county monitoring list, it's possible that we'll have to shift to more distance learning. But I'm hoping that, again, if we're able to contain things and we really do have good, robust testing, that we'll be able to manage and more schools will be able to open. So we'll see.
Yeah, I was kind of gearing it more towards the parents, the impact on the parents, and them being able to handle this. And
I know.
If any
to be able to teach and to also be able to get childcare access if they need it. And so
there is the Families First COVID Relief Act, I think it's called, FFCRA, that was passed, that provides protected leave to parents much like the Family Medical Leave Act does, to address issues like having childcare and or needing to care for anyone during COVID. So that is available. Some of, there are county staff that are using that as well because it's impacting everybody around having childcare issues at home. So yeah, I know that there's that available for sure.
Okay, good. Thank you. Well, thank you, everybody. Really appreciate the discussion. We have a new protocol now. We had been doing a COVID update every meeting. We'll be doing it every second meeting. So the next COVID update will be the first meeting in September. Again, thank you, Dr. Frankovich, Director Stevens, Sheriff Hansel, for all of your work. And thank you very much.
Thanks.
So that will take us to the next item on the agenda, which is public comment on non-agenda items. And so for those of you who have been waiting to speak about items that are not on the agenda, this is your opportunity. Look at the numbers on the screen, give a call in there, and then press *9 to be welcomed into the queue. And I believe we do have one already. And again, I will remind the caller earlier who called in about, I believe it was Hatcher, that now is the time to speak about items that are not on the agenda, and that item is not on the agenda. So going again to public comment, I do believe we have one hand raised. Welcome.
Estelle, can you hear me?
Absolutely. Good morning, Kent.
Good morning, Estelle. 30 days in Mexico, and I was down there to listen. So I did not see any TV. I did not drive a car. 3 phone calls, I think, back to the United States. Went to town 3 times. I was taken to town 3 times. Did not see a video. Did not listen to any music on any radio. Just spent my time listening to Mother Nature. And it's a very powerful place down there. Oh, Rex, you'll be proud of me. And not only do I have a hat, but now I have some cattle. I went ahead and bought a small ranch down there, 87 hectares. It'll support 20 cows, 10 of which will be, I'll have my friend down there have their family cows on and 10 for me. So now I'm not just hat, I have some cattle. Also forming the Mexican corporation. That's going well, transferring a lot of my assets out of here down to Mexico, where we're appreciated. Well, we have the ability, unlike here, to help people and do projects and things. 2007, I tried to put all these projects together. So you won't listen to me. So basically, Mother Nature and I talked, and she said, "You don't listen to Kent. You're not being listened to. So now you're going to be bad Kent instead of being good Kent. You will use verbiage that people respect is earned. I don't have the respect for this board for what it does. Steve, I'm not talking to you, Steve Madrone. And Mike Wilson, there's another issue here. So I'm talking, I guess, the other 3 of you. You won't listen to me. You won't help me do good things. And so I'm going to be disrespectful. For starters, you have no policy, procedure, or protocol for public participation in your meetings. There's no consistency. This should be a time set. When I first started, it was 1:30. So now you've had this poor person waiting on the phone and anybody else who wants to participate here forever. You don't want to hear from us. Well, you're not going to, I can understand why, because what you're going to hear from me is not going to be pleasant, because I'm tired of the bullshit. And of course, I'm going to be using all kinds of terms like that. And you can say, Kent, please don't use those terms. I'm going to be using those and a bunch of other ones that you feel are offensive, because nice words don't seem to work here. I have agendas. There's going to be litigation filed. All these little tools in the tool belt, and being very direct and blunt with incompetent people and people that are causing harm to our community, and people that are lining their pockets and the pockets of their friends who set up at the board, who line their pockets, get major contributions so they can be reelected. All of these things are going to come home. And like I said, you're in hell and I'm the devil. I love that. It was Bruce Wayne was in a movie, I think, and some big guy said it to him, and he proceeded to kick his tail end and 8 or 9 others. But anyway, it's just what it's going to be. It's going to be living hell, and you make your own world. So welcome to your world, and it's not going to be fun for you, and it's not fun for me to have to do it. But otherwise, we can't be able to work together, I guess, and get things done. So be it. And that's going to be the new rules of engagement here. You need a time certain for your public participation. You need a policies, procedures, and protocols. Otherwise, you will be sued on that. Thank you for my time to speak, Estelle.
Thank you. Let's go to the next caller.
Good morning, I'm here.
Good morning.
Thank you. I don't feel inconvenienced by this minor wait. It's mostly my fault for not knowing your process. Anyway, I'm here today to ask that you direct the public health officer to oppose the recertification of Hatcher. Prior to today's meeting, I emailed each of you some materials. One is a lengthy report entitled The Impact of a Socioeconomic Review of Supervised Consumption Sites in Alberta. And it's a very long study done throughout the province, and it mimics the problems we see here generated by Hatcher. And the other was a news article from last month addressing the fact that Premier rejects harm reduction during the funding for new addiction recovery centers. And then there he said, handing someone who's deep in addiction a needle is not a continuum of care. I don't even find it terribly compassionate simply to facilitate an addiction rather than offer a full spectrum of services for recovery and lifetime treatment. While Eureka PD was doing their undercover review of Hatcher's activities, one of the things noted in their very brief statement that was attached to their opposition for Hatcher recertification was the fact that one person came in with 2 medium-sized containers of used needles, exchanged them for 3 cases. This same person was later arrested with 2 pounds of heroin. We can only guess that that much heroin and that many needles are that not for that person's particular use. And that gets us back to what Hatcher's stated goal is, which is to put people on a path to wellness, to meet them where they are and not leave them there. And if they can get their drugs and their needles without ever having to come into contact with someone to get on that path for wellness, a good half of their reason for being is not there. You're not helping anyone more than you're simply facilitating their addictions. Another recent development is the state now authorizes handing out meth pipes. Hatcher's instructions for those include directions for how to get your best high, which is reminiscent of their safer snorting kit direction, which is rinse your nose with water and pull it down your throat so you don't waste any of your drugs. If we're truly going to help people, we need an organization that doesn't facilitate drug use. We give them safer snorting kits. We give them better directions for how to get high. We give them clean needles. And then when they've blown out their veins, there's actually an article in which Stacy Cobine discusses booty bumping. Stacy Cobine is one of the peer educators at Hatcher, from what I'm told. Booty bumping is putting it someplace when you can't get your veins up. When you've worn out your veins from years of drug injection, this is another way to get your high. I ask again that you... Go ahead.
Go ahead. The 3 minutes are up. I'm sorry, but go ahead. Just very...
Please direct your public health officer to oppose the recertification of Hatcher. Thank you.
Thank you very much. Let's go to our next caller. Hi, caller, welcome.
Good morning, Thomas Mulder again. I just, multiple things I want to try to bring up. First off, I would say I'm going to give a thank you to the ad hoc, Cannabis Ad Hoc Committee and any county staff that participated in making those drafts for the proposed personal use cannabis ordinance and also the mom and pop, as I would call it, language. So thank you, whoever worked on that. I look forward to commenting on that Thursday. On a couple other things, we need to work towards getting our county back to normal. I don't know what that's going to take, but we really, really need to work towards getting our county back to normal. I did hear that we're going to do every other meeting reports as far as COVID related. So I would hope that would also mean that we're going to cut our overtime expenses in half on a monthly basis. If the community and the public are getting half as much information and access, I hope that overtime is cut in half. I want to see a clear process. I would agree with what Kent was saying. If we're going to continue going through these Zoom meetings, that there's a certain time for public comment, because I know following the calls sometimes are challenging, and I know things have to get bounced around, but it's just something we're going to meet virtually, then let's try to make that ability for the public to participate as well. Thank you for my opportunity to speak.
Thank you, Thomas. Next caller. We have somebody else there. For number 8358, I think, or 56. Welcome.
Yes, hi, I'm 8356, otherwise known as Bonnie Pinkney. I live at 1401 3rd Street. I also would like to you guys to direct the public health officer to oppose the recertification of Hatcher. They have a long list of things that they're supposed to be doing that they're not doing, but one of them is to blend into the neighborhood, and so that we don't even, wouldn't notice the disruption. Well, since they've been here, that's all they've been doing is disrupting the neighborhood. Houses are sitting empty or unsold. Because of them, the Airbnb down the street for me sat on the market for 2 years. The person sold it at a loss, and the people that would come and visit would never, there was no them coming back, because the cited reason is that there's a needle exchange across the street, which of course attracts drug dealers and all kinds of unsavory groups. Also, I know the library had started implementing, have a private security company, SBT, I think it was called, and they did good for like the first week, okay? But it has been 5 days since I have seen anybody circle in that library. And we don't need them to circle the library at noon. We need them at midnight. And it's evidenced by the fact that there's 20 or 30 people at the library, every friggin' night, and the drug dealers that follow. So I mentioned the housing prices plummeted. Thank God I'm not selling my house, or else I would sell it at a loss until we get our shit together here. And also kind of tying in with the COVID and what we're trying to do, these Hatcher patients or whatever users, drug users, also seem to be pretty exempt from everything else that we have to follow. They're not discouraged from congregating in groups. There's a group at the library almost all the damn time, unless the library is open, and nobody's enforcing them to wear masks. So once again, they are given a free pass above the law that they don't have to do what they're supposed to do to keep society safe. And that is propagated by Hatcher. And I work in the mental health field. I work in CD counseling. I'm a psychiatric nurse. And I can tell you one thing for damn sure, after working in there for 20 years, you cannot provide drug counseling and then hand them a drug kit on their way out the door. It just does not work. Okay? So again, I wanted you to direct the public health officer to oppose the recertification of this drug operation. We have people showing up at all hours of the night on the library parking lot, blasting their music, because that's like the ice cream truck ringing their bell. That's how people know that the drug dealer is now ready for sale. So I'm sick of it. And there are people that are coming from all over the country. And woman from Michigan came all the way here so she could participate in the Hatcher program and get all the free needles that she wants. I mean, that's halfway across the country. That's not the population that we want to be attracting to Eureka, but it seems to be the case right now. So we need somebody at the wheel right now. And right now there's nothing.
Thank you, Bonnie.
So thank you. That's it.
Thank you. So let's go to the next caller. This caller's number is last 4 is 9161. Good morning, caller. Did you press *9? There you go.
Hello.
Hello, good morning.
Hi, can you hear me?
Yes, we can.
Sorry, it took a minute to unmute. Hi, my name is Mariah Miranda, and I'm actually calling on behalf of Bob Marks regarding the Dinsmore Junkyard property that was discussed at the July 14th meeting. I'm asking the board to reconsider the Hudspeth bid for $308,000 and instead allow Eel River Transportation and Salvage to do the work for $130,000 without placing a lien on his property. I'm asking the county to pay for the cleanup after all his years of service to the community. In fact, he didn't even know that this was happening to him until I called him and informed him that he was an agenda item on the Board of Supervisors meeting. He said he'd gotten a call a year ago for the county asking him to clean up his property, and he tried getting help, but he's 80 years old and he's had a hard time getting help. So I've actually learned a lot about Bob and all his years of service. And I actually went online and researched through the Labor of Statistics, the Bureau of Labor Statistics, and created an invoice that after 24 years of service being an on-call sheriff, that equals about $520,704. 24 years of volunteer fire chief, and I was actually incorrect because it's been 40 years. He's still the fire chief. Towing fees for 200 cars, housing the houseless. We're looking at $1,292,122.26. Also, after talking to retired Sheriff Jim Olson last night, who worked with Bob for years. He was on the tow rotation with the CHP. He's actually going to write a letter. He talked about how being on the tow rotation required them to pick up abandoned vehicles at their own cost. They did not get reimbursed for that. He is storing 200 vehicles as a service to the community. And after looking up the data on that, it literally came for after abandoned vehicle storage for $53 a day for 200 cars. It can, for 24 years, $99 million. He is being asked to absorb all of this cost. It is not fair to him. It is not fair to him to do that. He also was given an OES deputy coordinator by Michael Downey that expired in January of 2019. This is a man who has done nothing but give. He's given 32 cars to the Paradise Fire victims. He just gives and gives and gives. And now we're asking him to give up his land. It's not okay. Please reconsider your tactics. Please help this man at 80 years old not lose his home. We're helping him for free. We're going and taking a car a day. I'm asking you to help him. Thank you for the opportunity to speak.
Thank you, Mariah. I believe we have one more call. The last four are 1912.
Hello.
Good morning.
Yes, good morning.
Hi.
This is Gary Lewis. I would like to add my voice to those that are asking the health officer to write a letter to the state to oppose the recertification of Hatcher. I also live in the neighborhood and have been observing what goes on there for years. And the police report that came out in the Los Gatos Journal just recently made it very clear what we have been seeing. And I should say that that report is actually quite mild because it was only observing during open hours, 10 o'clock to 2 o'clock. What happens after hours is an even more severe problem. I should say, though, that none of us in the neighborhood are opposed to needle exchange programs per se. The county runs a needle exchange program. That program does not generate the problems that we have at Hatcher. The issue with Hatcher is that they fundamentally seem to believe that drug sales are a natural part of their business. They serve people with addiction. They provide them with needles. Someone who provides them with drugs is just simply adding to that service. So it's sort of one-stop shopping for people that show up at Hatcher, get your needles, hang out in the parking lot, and you'll get your drugs too. They don't see a problem with that. The result is obvious. We get drug dealers constantly circling the neighborhood, and naturally, the drug users remain in the neighborhood. They have no reason to leave the neighborhood. Hatcher provides additional services, some food and clothing, just enough to keep people constantly hanging out. And anyone who has visited the county library is well aware of the problem because, as Bonnie pointed out, there's a group of people there at all hours. And it's not just the library steps, it's the entire surrounding neighborhood, including the Carson House, where we get people from out of town coming to visit. This is the image that Eureka is putting forward now, an image of drug users and dealers hanging out at all hours. I don't think that's the image that we want to put forward. So I also strongly recommend that the health officer write to the state and ask that they do not recertify Hatcher. Thank you very much.
Thank you very much, Gary. I believe that's all the public comment we have on non-agenda items. Brian?
You are correct, Sheriff Fennell. That concludes public comment on non-agenda items.
Thank you very much. So we'll go to the next item on the agenda, and this one is comes to us from Supervisor Madrone. It is regarding Assembly Bill 1976, which has to do with Laura's Law. So I will toss it to you, Supervisor Madrone.
Thank you, Madam Chair.
This.
Yeah, go ahead. You have something else to say?
No, I was just saying that you're representing the Behavioral Health Boards as well, to the extent that you serve on that committee.
Absolutely. Yeah, thank you for that introduction. So the Behavioral Health Board met on this last month. It was a lively discussion, and they basically voted to put this on the board's agenda and request that the board support a letter supporting this bill. Just a couple of comments from some of the members of the Behavioral Health Board. One, it can help people on a potentially bad trajectory, jail, violence, etc., before they get worse. It is fiscally sound. It reduces incarceration and hospitalizations, which are far more expensive. Some people, according to Mendocino County, choose to voluntarily enter treatment when they see the handwriting on the wall that they may be going into a program where they need to go in front of a judge periodically. The program saves lives and is generally fiscally sound, as I said earlier. The details where the money comes from are definitely complex, and I believe that Emmy and Connie are here today to speak to that, because as we know, there is no new money, so to speak. It'd be wonderful if there was a money tree out there and we had the resources to do everything we want to do. And I know that public health and mental health and Director Beck and others, we all want to do all of the things we can for all these people. But at the end of the day, we only have so many resources, and very, very difficult decisions have to be made about where that goes. Another member of the board, the Behavioral Health Board, said that he supports this bill for the reason that it will bring other service options than just inpatient, improving services while improving the quality of life and building a stronger community. Nevada County had come and made a presentation to the Behavioral Health Board last year. I wasn't on the board at that time. They have opted to implement the law, and they have said it's been a good law for them. It's provided good service, and that it has been cost effective. So I know there are some concerns about this at CSAC and other places. They're asking for some amendments to it and other kinds of considerations. I also know that we have limited resources, but this seems like a good tool for the extremely mentally ill, and I'm very pleased to bring this forward for the board's consideration today. Thank you, Madam Chair.
Thank you, Supervisor Madrone. I would like to go to either Emily or Connie to discuss this a little bit. I know, as you are probably aware, I've always been a very strong proponent of Laura's Law, and I'm glad to see us discussing it again. But in terms of this bill, what are your thoughts, or if you can give us some input on how we would handle it?
So I have our mental health director, Emmy Bossler-Rogers, and also Paul Bagnacki, who's deputy director, who's worked significantly on this issue. So I'm just going to turn it over to them and let them speak. Thank you.
Okay, thank you, Director Beck. So Emmy or Paul, whoever wants to go first.
Sure, I'll start, and then Paul can just add his comments or thoughts. Just to add a little bit of context to what Supervisor Madrone already said. We did have a presentation from Nevada County last November, and they have implemented the law because it's a mandate for their county. They were part of the original settlement almost 2 decades ago now in 2003, and they have found some real advantages to it, absolutely. We've been thinking about this over the years, and this is now kind of on the table again because there's this bill that would make it a mandate to implement unless you opted out, as opposed to it just being an option, which it currently is. I think at the time of the presentation by Nevada County, we had agreement around the strengths of this particular type of service. And shortly after that time, a few things happened. We began implementing other similar programs and services that kind of meet the need in other ways, including mental health diversion. And then we had COVID that began. And so both of those things, I think, kind of delayed our continued thinking about next steps for this particular service. As Supervisor Madrone mentioned, this is an unfunded mandate, which I think is probably the biggest challenge, not just for our county, but for other counties. And so we're looking not only at the current behavioral health deficit that we have had here in Humboldt County for many years now, but we're also looking at that overlay of the impact of COVID on our economics and the decrease in funding. And so for Laura's Law, we would be looking at realignment, which is already in short supply, and we're not allowed to decrease any of our other services in lieu of adding this service. And so it really would kind of be a conundrum for us to look at how to continue providing everything that we're required to provide and add this on as another service with very, very limited funds. Let's see, what else? You know, it would absolutely take kind of commitment, not just from us, but from a number of our partners, including the courts, to be able to give resources to that. So I think in some ways it's that broader discussion. And again, as Supervisor Madrone mentioned, both CSAC and CBHDA have concerns with this particular legislation moving forward because it's a mandate as opposed to just an option, which is where it currently stands, something that we could do at the point where we felt like we had enough resources, as opposed to requiring us to do it unless we opted out via the board. So that's kind of the context, and I'm open to questions, and I'm also open to anything that Paul or Connie want to add to that.
Thank you, Emmy. Paul, did you want to add anything to that?
No, I don't. Emmy provided a very good overview of assisted outpatient treatment and some of the challenges associated with it.
Thank you. Any questions or comments from the board? Supervisor Bass.
Thank you, Madam Chair. And even before you were on board with Laura's Law, I was there with the mental behavioral health board when this all first started. So, and I know I went and talked with Connie many times, but I also understand that they're pulling together similar programs to do the same kind of services, because creating the the whole new system seemed kind of unwieldy and definitely financially not too viable even back then. I'm just curious what I've not been involved in this discussion at CSAC, and I'm wondering, I don't know if it's Supervisor Madrone or Emmy that can tell us what it is that they're looking for amendments, and what is the likelihood? Because I mean, I would prefer that it was not necessarily listed as a mandate, but I'm just curious to know what's in the works on this as far as legislation and amendments. So I don't know who can answer that, but the dog.
It's very wise. Did you want to say something, Supervisor Bohn?
No, I can remember this being 8 years ago. This was forefront, and I mean, my first couple meetings, and I remember talking about this, and part of it was the implementation. I mean, we butted heads with Director Crandall back then, and I don't think he ever saw a program he didn't like unless it wasn't paid for. So, and that's the problem now, is financing this. So do we take some of the programs that we're trying to kind of imitate Laura's Law and weaken those to do Laura's Law, and then have a whole bunch of weak programs, or stay with what we have? And I'm fully supportive of Laura's Law, but it's kind of like anything. It's kind of like building a house, but not being able to hook up the plumbing and the electrics. I mean, you've got to have the full balance there. And it just sounds like, because it's a great idea, but it's just, so I worry about the funding aspect of it. And I see the same thing I heard 8 years ago. The money to run the program, even albeit small and slight what it would be here, is still pretty intensive. So I have some concerns. I was trying to look over the weekend on CSACs on the amendments, and I didn't follow up, and I called RCRC too, and I think I got some stuff after the meeting started. So I don't know if we're quite ready. We're ready for it. We're ready for it. We need it. Can we pay for it? That's my concern. To do it right. It doesn't do any good if we don't do it right.
Supervisor Madrone?
Yes, thank you, Madam Chair. No, I certainly appreciate my colleagues and the representatives from DHHS's concerns about funding. What's important to recognize is that what we're doing here today is simply considering whether or not to send a letter supporting this law. And if it were to pass in its present form, we still would have the option to opt out. So it's not a mandate. A mandate is you've got to do it. There's no options. This is a partial mandate that gives the counties an opt-out option. And so we can always do that, but we could also simply send this letter with maybe one more sentence added at the end of the letter that says, we also request that the state provide funding to the counties to help implement this. A simple statement that I think we all agree that if we're going to do this, we don't want to strip other incredibly valuable programs or new innovative things that we're trying to do in mental health. So if we just added a sentence like that at the end, it would make it clear that we're asking for the state to step up and help fund this. And again, I will say, we have the opportunity later, if this does pass, to opt out. And so it doesn't seem like there's really any threat or danger in proceeding doing that. And I would suggest that we add that one sentence to the end of the letter. I see Supervisor Bass has some comments.
Yes. Supervisor Bass, yes. Go ahead.
Thank you. No, just a question on that last sentence, because I've seen so many things now with last sentences that if they're put wrong, you can end up in a really bad place. Because if we say providing the money for it, then we'll have to take it from one of our other things, you know. And I think that was kind of, I think Connie alluded, or Emmy alluded to that. So I think, you know, you can, that type of sentence can certainly be added there. I just really want to kind of like carefully craft it, because we don't want to accidentally support something that says, hey, you know, we don't mind giving up some of our realignment money to go do this program instead. Not saying that the state would do that or hear it that way, but I think Supervisor answered that. It could happen.
Yeah.
Really?
Well, I think the idea of adding that letter, because that is the real thing. We have two things. First of all, I agree that this law would just give us an opportunity to opt out. What's so scary about that? Right now, we're not opting in. We'd have to state clearly why we can't do it. And the reason we can't do it is because of the funding. So definitely adding a line in there about saying that that is our main concern. We want to do it. And just saying maybe funding outside of realignment or in addition to realignment, just spelling that out. And then the other thing we have to really think about is why are we so caught up in this whole mess? We're caught up in the mess because this was put in place because of a very dangerous situation where somebody lost their life. And I have, and Connie knows this well, have been involved in a number of issues where people had gone through all the cycles that you could possibly provide at the county and still needed help. And they couldn't give it because of there not being that ability to actually require treatment without their consent. So that's what Laura's Law does, is it says, you know, we as a community understand that this person cannot make a good decision about their health, and we're going to make that and help them. So I think it's a really important issue, and I would like to support it. I think that I agree that we have the opportunity to opt out. That opt-out can be based on the funding situation, but we can also add that into our letters that, you know, this is our main concern, is the lack of funding. And I think, I don't know, but maybe there's a chance that that could be folded in to the bill if there were enough counties doing that. And I would hope that that's where CSAC would go to. Supervisor Bohn.
I'd like to make a motion that we just follow staff's recommendation and send the letter. We can rewrite the letter. We can do whatever you guys want. I don't think we're going to make a difference where the boat swings on the Humboldt with the state, but we all support Laura's Law. We don't have the money to support it. I don't think we're going to be the swing vote. So let's let them know where we stand. And if you guys want to rewrite it, send a separate letter or something like that. But I just support staff's recommendation.
Second.
I have a motion and a second. Supervisor Bass.
I don't know if it'd be that hard to add a simple sentence similar to what Supervisor Madrone mentioned. It's like something provided that the state's providing new funding for these services. I don't know how hard that is. And you're right. They probably are. Ours is not going to be the swing that, you know, thing that all of a sudden the state goes, you know, we're going to take their money from here and put it over there. I'm just being extra cautious. I mean, I will vote for it the way it is. I just would just feel more comfortable if we put some simple sentence that states the point, or even it's like, you know, our concern is we can't afford it. I don't know what it is, but I don't think it has to be hard. But if no one else is interested in that, I'm not gonna push it. So,
Emmy,
I just want to add a couple pieces of information to make sure the bill is fully understood. It additionally expands those who are authorized to request a petition. And so that just opens up the playing field a little bit, that more people can be petitioned, which then requires the behavioral health department to conduct investigations into the appropriateness of each of those individuals. And there is pretty specific and in some ways restrictive criteria for people to be able to qualify for AOT services. So just wanted to add those two things as you're, you know, moving forward.
Thank you, Emmy. Supervisor Bohn?
Yeah, and I think Supervisor Bass can use her position of power with CSAC and following up with what Emmy said. And I'm pretty sure those are probably in the amendments that CSAC are seeking. Say that 5 times real quick. Anyway, and I think what you're going to see is we need to support the organizations that we belong to and support us, and looking for those amendments and making sure they do follow. So with that being said, I can change it to add a sentence or not, but I think the idea is support the agent, the groups that are supporting us, of trying to get this dialed down to what Ms. Rogers said would probably be the most appropriate way, because it does, and thank you for bringing that up, Emmy, it does expand the powers, and all that does is as people get more power, it creates more burden on our mental health staff. So either or, I can amend it or not if somebody wants to, but
Supervisor Bass?
No, maybe the thing is to send it the way it is. And if we determine 2 weeks from now that there's some real unforeseen issues, that doesn't stop us from submitting a letter saying, we're changing our minds, so we can send it as is. I want to support staff. And the Behavioral Health Board, they do a lot of hard work and I want to support them. And it's just always makes me nervous expecting the state to necessarily understand what it is we need if we don't tell them. But
really,
yeah,
can't imagine that.
I know.
Supervisor Madrone.
Well, I appreciate the discussion, and I too want to respect the work of the Behavioral Health Board, and I think you probably all rotated through that board at one time or another. It's been an incredible experience for me. Amazing individuals, both with the county and volunteers that are on the board from the community, and the hard work that they do. It's just really nice to respect that work and to support their efforts. So thank you, Supervisor Bass, for those words. So I'm ready to vote. Let's we've got something at 11. It looks done.
Yeah. Okay. Any further comments from the board? With that, I'll look for comments from the public on this item. Are there any public comments on this item? I believe we have maybe one hand raised there, Ryan. Welcome, the person on 7728. Hello, you're on the call right now.
This is Tim Ash. I don't know if this is the time to speak.
We're talking about Laura's Law and AB 1976.
Okay, I just want to say I appreciate the discussion that's gone on, and I think, like anything nowadays, it's difficult to, to figure out where the money's, scarce money's going. But what I would like to say about this bill, Behavioral Health Board did discuss it, and to the question of cost, Nevada County, as Emmy Rogers mentioned, gave us a presentation, and they save about $1.80 per dollar spent using this. There's definitely some reshuffling of where money comes from, which could be problematic, but it saves money on incarceration. It saves money on hospitalization, and it saves lives. Frankly, it saves lives and bad outcomes like incarcerations for people that with treatment can do better. The number, unfortunately, as Emmy Rogers said, is a small number of people that will qualify. But nevertheless, those people they kind of fall through the cracks because they don't actively meet the criteria for immediate hospitalization, but they're kind of on that road. Anyway, and as Supervisor Madrone said, it's not mandatory, and but what it does do is it'll give our community an opportunity to discuss it, because law enforcement, this is something law enforcement likes. The California Peace Officers Association, California Sheriff's Association, all support this, but as far as I know, we haven't had that discussion in this county of how can we do it. And the last thing relative to funding is that I do like the idea of going to the state and talking to them about sources and ways to kind of maybe redirect dollars. But the Mental Health Services Act those dollars can be used for this. I guess the question that needs to be answered is, what would it take? How many people would qualify for the program, and what would it cost? And how could we do it? Because 20 counties are doing it, and the numbers are increasing, essentially every day, people are opting into this. So anyway, I appreciate the discussion and definitely support writing a letter to the state, and hopefully they will, the legislature, hopefully they will pass the bill. Thanks.
Thank you very much, Tim. I believe that's the only comment on this item. So I'll bring it back to the board. And unless there's further discussion, we do have a motion before us, and I'll ask Ryan to call the vote, please.
In for.
Thank you.
Yes.
Thank you. Thank you, Supervisor Bohn and Bass. Supervisor Wilson.
Yes.
Supervisor Madrone.
Yes.
Thank you. Supervisor Fennell.
Yes.
Thank you. Passes 5-0.
Thank you very much. Appreciate the discussion, and hopefully this will help move us forward. And again, thank you to the Behavioral Health Board as well for stepping up on this. And thank you to Connie and Demi and Paul. So we'll go now. We actually have a time certain at 11 a.m., which is just 2 minutes away. So we're just going to take a very brief break, 1 minute break, and then we'll come back to a presentation of the Headwaters Fund annual report. Oh, how's that for perfect timing? It's exactly 11 o'clock. We have this item set for time certain. And this is a presentation on the Headwaters Fund 2018-2019 annual report. So welcome Kenneth and Scott and Mr. Hansen. This comes to us from the CAO's office, so I'll ask CAO Nelson to introduce the item. Good morning, Amy.
Good morning. Thank you, Chair Fennell. As you mentioned, this is the annual Headwaters Fund report. And with that, I'll turn it over to Kenny Spain to deliver the staff report, and also turn it over to Carl Hansen as well.
Great. Thanks, Amy. Yep, Kenny Spain, Executive Director, Headwaters Fund. And Carl Hansen is ready to present the report, and it is for fiscal year 18-19, running a little late due to the COVID-19, but it's all complete. And I think that you will be pleased with the outcome that we have. So with that, I turn it over to Carl.
Good morning. Thank you for the opportunity to share a little bit of the output what the Headwaters has been up to. I actually have kids with me today, so I apologize for the background noise. I'm going to share my screen here, if I can. It will allow me to do that.
Ryan, can you help Mr. Hansen with sharing his screen?
There seems to be that I can share my screen, but it's not allowing others to share their screen. And I'm not seeing anywhere to change that right now. So I'd be more than happy to get the email with the presentation, and if they'd like to send it to me, and then we can do it that way.
I can do that real quick, just a moment.
Thank you, Kenny.
And in the meantime, we can go ahead and share a little bit of information. This year, we've been kind of changed our focus significantly to focus on business continuity. In the past, we've really focused on innovation and creating opportunities for businesses. This year, we've totally focused on just sustainability. And I appreciate that the board has provided a replacement member so that we are back to full capacity. We've really been busy. There's been a lot of activity going on, and we have a great board that's focusing on getting money out into the community and really being as productive as we can. We've primarily, we have two kind of strategies. We have lending that we are doing. And so through the Arcata Economic Development Corporation and the Redwood Region Economic Development Corporation, trying to get funds out to the local businesses that aren't eligible for other traditional loan sources. So that's generating earnings back to the fund. And we're being very, I think, very judicious in how we utilize and leverage those funds to kind of keep in a longer term perspective, keep funds available and apply them where we can have the greatest impact. And that the impact is typically through small grants or competitive grants. So those are the two basic areas that we're putting money back into the local economy and the local businesses. So with the small grants, we'll do a match up to $5,000 when local organizations have particular needs. Ryan, were you able to get that?
We are good to go. I can go ahead and start the presentation.
Thank you. Okay, great. Perfect. There we go. All right, if you can go to the next slide. So as I was mentioning, the revolving loan fund, we're pleased that in 1819 there were 0 loan losses. We're always kind of setting aside some money, thinking, you know, we're putting money into the businesses that can't get traditional loans. So there's a little bit of risk there, but we're also the AEDC and RE and REDEC are, I think, really great partners. So they've done a great job of managing the resources and supporting businesses. So in this particular year, overall, you'll see in the box there that there's only 3% loan losses over the historical time that we've been managing these. So it's pretty minor. And for businesses just in the last year that have been supported, you can see the dollars there, the jobs retained, and then projected new jobs. So, you know, that's what in our opportunities to put money into businesses, we're really looking at job creation, sustainability of living wages, and then also, you know, kind of creating new job opportunities. So we can see here the projected new jobs that have been generated by those loans, and then again, bringing money back into the portfolio. So earnings from the loans as well as then just earnings from the endowments, the endowed fund. So next slide, Ryan. Kind of try to zip through these. So again, you can see earnings, and a lot of this is going to be dependent on the state of the economy and how well the economy is doing to bring back earnings. On the next slide, so that's just for the revolving loan fund. The next slide then, again, the funds that are invested through the county in addition to the revolving loan fund. So that's bringing in the money that we are able to put back to reinvest in the community. So you can kind of see we've been maintaining a balance there. Next slide, Ryan. And so for the revolving loan fund, again, this is where we're supporting those businesses in the community. One of the things that AEDC and a number of others partnered on is getting the Hoopa Shopping Center opened, which is huge for that community. We're excited to be a part of that effort. You know, just as many partners as we can to create that. And then another example, and these are just, there's lots of businesses out there being supported. Another example was Kenny's Chocolates. So we have AEDC working with the Hoopa Shopping Center, REDEC working with Kenny's Chocolates to be able to expand the business. So those are the examples of ways that we're reinvesting those funds. Next slide, Ryan. And then we also do mini grants. So again, kind of matching funds for a lot of initiatives that have some support that they can demonstrate that there's other community support out there. And we'll match that if it contributes to the mission and the goals and the priorities of the Headwaters Fund. So one example of that was the Eureka Street Art Festival, trying to promote the beautification as well as bringing in tourism. So it kind of hits two prongs of some of our strategies there. So next slide. Another example was the Blue Ox Millworks, which is, you know, such a great local organization, something we all have to be super proud of. They do such cool work there, and part of the engagement with vets and with young people, there's just nothing better to support than the work of the Blue Ox. So we're happy to contribute to what they were doing there. So next slide. And of course, the long term has been the decade of difference, 10 years of supporting the Humboldt County Office of Education in this very particular initiative, this being the final year of those 10 years. But last year, which was the 9th year of that series, this is some of the outcomes that they have shared with us, how that money has been kind of invested in some of the goals there, increasing graduation rates, increasing literacy, getting out scholarship dollars. There's just so many great things. And I think that you've had some presentations from the Decade of Difference. But again, we're super happy to be a part of that and then seeing some of the return on that in our communities. And this is one of those things starting early, and then it's going to carry through. The benefits to our community will carry all the way through. So next slide. So here is by clusters. So all of the different industry clusters that we have been supporting. That's one of the things that we're looking at when we have an opportunity for grants to put money back in, thinking about what those clusters are, how we can support them, and again, what the mission of the Headwaters Fund is, try to be kind of diverse in doing that, but also then where we can have the greatest impact. So we're always interested in retain jobs and job creation. So those are the kind of important things that we look at when we're getting grant requests. So you can kind of get a sense here of where that's going. And, you know, a lot of it's interdisciplinary, multiple industries, which is great because it has an impact across different areas. Next slide. So in the competitive grants, so when we have an opportunity, we'll set aside a certain amount and then we'll do a call for proposals. And it's a competitive, so we will evaluate the quality of the presentations. We have a criteria established, again, what's the greatest impact? And then we'll award as much money as we have set aside and fund the projects that we can. So an example of that was partnering with the Humboldt Senior Resource Center down in Fortuna. You know, it's been under construction, a lot of partners in that project, and we were excited to award them $30,000 towards, you know, a small part of that overall project. So next slide. So again, historically, the life of the Headwaters Fund, you can see we put out $12 million in grants throughout this time. Also have put out $13 million in loans. So the nice thing about the loans, the recycling, and then that helps us to support these new initiatives, the small business and the competitive the competitive grants. So 426 businesses and agencies served by those grants, projecting overall 848 jobs created or retained. That's based on self-reported information from those businesses as part of the loan processing. So it gives us a sense of the impact that we're having. Next slide. There we are. So again, give your brains a chance to just kind of relax a little bit and enjoy some information about the impact that we're having on the community. In 2002, the fund started at a little over $18.4 million. Starting at 2018, there was $17,282,000. Ending the year, starting with $17,165,000, ending the year in $17,282,000. So it gives you a sense, just looking at the numbers, we're bringing in the dollars, we're managing them for the long-term viability and sustainability of this initiative. We're being conservative in the sense of not overspending and drawing down those dollars so that we can have a long-term approach to keep supporting those businesses. And clearly we're able to put that money back into the local economy. So we aren't holding on to it, we're putting it out there. And again, last year we were kind of had the opportunity to do a lot more in the grant making business. This year we've really changed strategy. Like I said, we're into sustaining those businesses. We're putting a lot of money in there to business loans to keep them going. We will be having a competitive grant round coming up later this year. We were just holding back, again, just making sure that we can keep businesses afloat for now, helping kind of bridge to some of the other federal and state aid that might be coming in. And obviously it's super important to support those local businesses. We got to keep them alive before we can worry too much. So look at that. Nice, Rex. There's something that feels good. 12 million. All right, so we're happy to entertain questions, feedback about that.
I'll ask the board if there's any questions. I just wanted to make a comment of where, obviously we're looking at 18, 19, but you touched on the fact of that present reality. And I think it wouldn't hurt to let people know just how much the Headwaters Fund has been helping in that regard too at some point, because it has been pivotal for some companies to help with both AEDC and etc.
I could give you just a quick update if you would like, Estelle.
Yeah, please, Ken.
Chair, sorry. So the PPP loans, the payroll protection loans that AEDC is administering for us, they were up over $1 million at one point. A couple backed out because of the uncertainty in the SBA PPP program as to, exactly, they've changed the rules a couple times. And so, but we ended up doing about $945,000 of the $1 million that we had sent over originally. And then out of REDEC, we advanced them $500,000, and Greg, the executive director, Greg Foster, worked with other organizations too to spread the risk. And so we ended up doing $232,000 out of that 500. And so we've had both organizations return the balances for now. And our board will be looking at future distributions. Right now, the main thing I think that Past Chair Hansen was just expressing is that trying to be very prudent in the use of our funds this year. It's a tough time. It's very similar to the 2008 crash. And we want to make sure that we have ample funds, to continue the fund in perpetuity. And so we don't want to say that there are business losses coming, but that's certainly a possibility. We did have one during the 1920 year, a small one, 34,000. So, and we've already started on the report for next year, the 1920 report. Typically, we will wait for the Auditor Controller's Office to close out the year, and that's generally in anywhere from September to November. It was late coming this past year, as you all know, and we've talked with the Auditor Controller and let her know that we were going to go ahead and move forward with our report, and then if we need, we'll make adjustments in the next year, but we're going to utilize our own internal reports that for the payments that we receive from ADC and REDAC, and we'll balance after the fact. So this report for 1920 will be coming hopefully by November. It typically is shared with your board sometime between January and March. So we're trying to get back ahead of that. And we had a very robust competitive grant process this last time. And then we also just sent, as you know, the $125,000 from Headwaters over to match with the Humboldt Area Foundation. And so that's for grants to the competitive grant process rather than doing a round and taking the time that it takes. We have made those funds available now. Their contract's just being finalized, and so they'll have the money in their hands in just a couple days. So things are moving fast. We're doing everything we can, but still being prudent. I'd like to say it kind of reflects. I happen to have a similar philosophy, is that being conservative, fiscally conservative, but socially moderate. So we do everything we can afford to do, but being prudent and maintaining those funds. And we're actually just below where the fund began in 2002. So, and I know there were some, there were about 4 years where there were some real downturns in it. The base eroded, and now we're up to doing a much closer to the original fund amount, in spite of putting out the $12 million in grants. So,
I'd like to go to Director Adair. Scott?
Oh, yeah, through the chair, if I may. I just noticed Supervisor Madrone raise his hand while Kenny was talking. I don't know if he had a question or if he was adjusting the light.
Okay.
I just wanted to make sure if he had a question about the program.
Thank you very much, Director Adair. Supervisor Madrone. Oh, but actually Supervisor Bohn had his hand up first, so I'm just going to go quickly to Supervisor Madrone, then we'll go to Supervisor Bohn and then Madrone.
Well, thank you, Madam Chair. Which own are we doing, the Bohn own or the Madrone own?
Yeah, we're going on the Bohn Madrone.
I like that. No, I went and stole that check out of Supervisor Fennell's office just because this came up, and it says it's for job placement and training, and you guys have done a really good job, and I do think you need to be fiscally conservative because we are going to be facing some tough times, and if depending who you listen to, it's going to get a lot worse before it gets better. So I think we can look out for our essential small businesses, the ones that have an opportunity, and do just what you're doing. I appreciate all the work Carl and all the volunteers are doing on the Headwaters board. It's kind of, we talked, I remember when we interview people, it says how you can get the Headwaters, the word out there. And I think that's important so people to see. This annual report's great, but I think it's really important we get this word out there, because this is a positive that came from, from this funding, but this is a positive that we're spending and actually making work for us. So, and we haven't rifled it. So that's always good when government doesn't do that. So thanks for being that fiscally conservative board. Thanks. I concede to Mr. Madrone now.
Thank you, Supervisor Bohn. Supervisor Madrone.
Thank you, Madam Chair. Yes, I was adjusting the light to shed even more light on the incredible job that the Headwaters Fund Management and Board have been doing. So thanks, Scott, for that. And as a fellow fiscal conservative, I seriously appreciate the approach that the board and Headwaters staff have used in making those decisions. It was a little worrisome when the money was going way down over the years from the 22 million original allotment. But as you said, we're getting close to heading back to that because of the really responsible management that's been going on here. And it is wonderful that $12 million worth of grants have been able to go out thanks to the interest that has accrued and thanks to the responsible loans that have gone out. There have been only a few that have not quite made it, but that's a tribute to, the hard work that you were all doing there. So really just trying to shed more light on the great job you're all doing. Thank you.
Thank you, Supervisor.
Thank you, Supervisor Madrone. Any further questions or comments? Okay, so let's go to public comment on this item. I know that there is at least one person who'd like to speak on this item. And again, if you're unfamiliar with the process, you can see on your screen number to call, and then press *9.
Estelle, can you hear me?
Yes, we can. Welcome.
I would like to make comment on this. You have two rock stars here, and you if we still can get all that money back from New York City, because maybe they can convince a local bank to give us the same rate of return. If there's any banker out there who's halfway responsible, or if you know one, please get together with the county, John Bartholomew and Kenny and Scott, and bring back our money out of New York City and put it to work. Kenny Spain and Scott are AAA rated people as far as what they're doing with Headwaters. And I don't just, you know me, I don't suck up to people. But these guys are fantastic. They are sharp. They can actually say, we are from the government, but we are here to help. And I can't think of any other part really that's anywhere close to what they're doing with this. And I want to do a shout out to those two people. And I think you should give them a raise. I've got a bunch of other people I think you could cut their checks way down, and I'd be happy to give you a list of that sometime. You know me. But these two guys are fantastic, and great job, and kudos. And let's get that other money back here and put it to work. Trust them with more and more of what we've got here, because I trust these two individuals. And if I do, I guess everybody should. That's just my opinion. Thank you for the opportunity to speak on this wonderful, nice topic today.
Thank you, Kent. I don't believe we have any other comments. That correct, Ryan?
You are correct, Chair Fennell. That concludes public comment.
Okay, so we'll bring it back to the board. And again, really, really appreciate the work. And, we are, a lot of us, soaked in this whole issue that we're dealing with right now. But having to look back at just the template that you set in terms of weighing the grants and the loans and making it all work is really great. And it's really good to see how you've shepherded those funds and taken down the responsibility. So thank you. Supervisor Madrone.
I move that we receive and accept the report.
Second.
We have a motion and a second. I don't believe we have any further discussion. So Ryan, will take it to you for a roll call vote.
Yes, Chair Fennell. Thank you, Supervisor Bohn. Supervisor Bass?
Yes.
Supervisor Wilson?
Aye.
Supervisor Madrone?
Yes.
Thank you. Supervisor Fennell?
Yes.
Thank you. Passes 5-0.
Thank you very much. Really appreciate it. So I know that Carl made reference to us making the board whole again. That is an item we're now going back to as part of the agenda is the appointment of Michael Fields to fill the vacant seat on the Headwaters Fund Board. So we'll go back to CAO Nielsen, I believe. This comes under your bailiwick.
Yes.
Thanks, Amy.
Thank you, Chair Fennell. And as Kenny Spain is our executive director of the Headwaters Fund Board, I'll be turning this back over to Kenny. Thank you, Kenny.
Thanks, Amy.
Thank you, Amy.
Yes, through the chair, this is a pleasure to recommend Michael Fields to as the next board member. We had a vacancy in March, and again, things with COVID, it was very difficult to get people to apply, and so we feel really good that we did end up with a very qualified applicant. In fact, a group of 4 applicants. I was surprised by the number of people who applied. It was only 4, but we reached out in multiple directions through social media, through our CERC calls, the COVID Economic Resilience Consortium that we meet 3 times a week, and up to 80 people on those calls. I reached out to people of the Black Humboldt, reached out to the Hoopa tribe, got the word out as much as we could for 2 individuals that we knew, plus just trying to increase our ability, our outreach, which we've been doing a lot more on all of our grant programs too, just as a side. But yeah, I'm really happy that the chair or the subcommittee recommends to the full board that Michael Fields be our next board member for the Headwaters Fund.
Thank you, Kenny. Does either one of the subcommittee want to discuss this? Supervisor Wilson, Supervisor Madrone?
Actually, it's me.
Okay. Oh, is it you?
Also-
I'm so sorry.
Okay.
I'm so sorry. Go ahead, Supervisor Beth.
I would echo what Kenny said as far as, it wasn't really, how do I say it? Everyone had something to bring to the table. And, I know it's always hard when you can only choose one person, but I think what we were doing in the conversation, or at least afterwards, is, we'll ask people to consider being involved. It's not necessarily they necessarily had to have the Headwaters. It's like people saw an opportunity to be involved. So we've actually got at least one member, I think one of the applicants is actually now on our, Measure Z committee. It's part of it, just people would like to be involved. And Michael clearly had an amazing resume, especially with all the dollars he had been responsible for being part of, as far as grants from other organizations. And but they all were great. We had really good conversations, and it's always hard to say, we just only get to pick one. So I don't know what Supervisor Wilson mentioned. You also might want to ask Mr. Bartholomew if he's on, if he has anything to say. I don't see him though.
I don't see him.
Yeah, I'll just say that it's true that what Mr. Spain says, the pool of applicants, although not huge, was well qualified and good group of people. It does, and this is not on. And I will say that Kenny has also reached out to try and get more applicants and to diversify our applicant pool too. I mean, to be quite honest, we got to do more. It's on us, all of us, to do more. It doesn't mean that it just doesn't mean we stop ever trying to do that. And I appreciate those efforts. And nonetheless, I think we have a great applicant here who is going to do a wonderful job, very involved in economic development in some certain sectors, but also just generally with state programs as well. I think it's going to be a good voice, and so I'm happy that we're moving forward.
Right, thank you. Supervisor Bohn?
Was there, and I bring this up because it was asked of me, was there any problem with, I know Mr. Bartholomew, who's on the panel, also serves as chair of the board of Del Arte, I believe, right? Was that an issue, or did that even come into play?
Well,
I'm asking for someone else. So.
Well, I mean, I can address that a bit. It's that we do have people who serve on multiple volunteer boards across our community. These are volunteer boards. These are not conflict of interest as you would, because they're not related to people's incomes or those sorts of things. So from that perspective, I think we're all right. And I don't think that there's an issue.
Okay. Asked and answered. Somebody asked me, so.
Supervisor Bass?
And I would just add, we actually worked around, on this issue for probably 3 weeks before we brought it back. We took a lot of time to be very careful in consideration, reaching out. I tell you, when I reached out to Bruce Rupp, if any of you know him, and he had just met Michael, but Michael sat in on one of the meetings and asked, I guess, really superb questions. So you guys, he's like, I can't wait to work with that guy. So, I appreciate Supervisor Bohn bringing that up, but I think, we worked through that, and I think Michael will be a good choice. That's why we have him on there.
Okay. All right. I don't think anybody else has got comments at this time, so I will open this up to public comment. I do believe we have one hand up there. And I think I know who it is. But
Well, you must be a savant psychic also, Estelle. You couldn't do any better. I looked at the pool of 4 people there, and I've gone ahead and vetted 16 people before, and you know, I called Bonnie Neely once, and she darn near hung up on me. Said she wouldn't. She was the reference for the person. I don't think she knew her, and I think she maybe had been doing a little adult beverage or something, but she wouldn't talk to me. She said, "Well, I'll talk to the supervisors, but I'm not going to talk to you." So didn't have to vet these people. 4 exceptional people, and Michael, as Bruce brought up, he works with people well. I've never met anybody who did, and he is sharp as a get out. And I don't know who was. I know Rex just brought it forward, but you know, any kind of conflict of interest, I think Michael and Mr. Bartholomew are 2 of the most honest people that I know. And I really don't know where that question came from, but I guess it's okay. Again, those other 3 people, they'd all be great. So good job, and I think this is a continuance. I think Headwaters will continue to do good things. Michael's skills as far as procuring, administrating grants. I worked with them on a major construction project, and they were running out of money, and he was always out there and always able to. We had to shut it down a few times, you know, which is fine, but we were able to move forward with a very large project out here. So you've got a real sharp tool in your tool belt there, Kenny. I'm sure you realize that, Kenny and Scott, to work with, and I think good things will happen from this. So good job, and Michael, I really appreciate you being willing to take your valuable time and applying to help us here. Thank you for my opportunity to speak.
thank you, Kent. And we have, I believe, another caller. Caller, you're on there. So 2450.
Oh, good morning, Chair Fennell. This is John Bartholomew.
Oh, welcome, John.
And since my name was brought up relative to Michael Fields, I just thought I should report that during the panel interview, I purposely waited for all other panelists to make their recommendations for that turned out to be Michael before I spoke up, because I do know Michael personally through the Del Arte board, and I have very high regard for him and totally am in support of him being the new board member. So I thank you very much for the time, and I hope you have a fine day.
Supervisor Bohn has his hand up. I'm just wondering, did you
Point
have
of
a question?
clarification, I'm not questioning anybody's. I just asked if it came up because I'm kind of like Mike, channeling my inner not Virginia. I'm just saying it was asked of me, and in this day and age, I get more people sending me questions to ask rather than showing up at the meetings and things like that. So it was asked. I'm going to vote for Mr. Fields. I have no problem with it. So but if you don't ask and answer, then it doesn't look like it's being as, what's the new word, transparent as possible.
Thank you. I believe that's all the public comment that we have, and I'll bring it back to the board. Supervisor Madrone.
Thank you, Madam Chair. I'm very supportive of this particular appointment, and I really appreciate the work that the committee did to vet that. I know that takes a lot of time to really interview everybody and go through that process. So thank you for doing that. You know, I'm thinking back to one of the early plays that Del Arte did called Intrigue at Apa, which I don't know how many of you saw that back in the 1970s, 80s, whatever that was, Michael. But one of the originals, and I'm sitting here and I'm thinking, intrigue at Headwaters, you know, I don't know, but the intrigue is this little fund that could, like Thomas the Engine, you know, the little fund that could make all kinds of great things happen for small businesses and community efforts in Humboldt County. So that would be the only intrigue that I can see. And I don't know, maybe it's fodder for some play material someday. I'll leave that up to Michael and the experts at Del Arte.
Maybe we could fund it.
Is that your motion, Supervisor Madrone?
Supervisor Bass.
Well, I was going to make a motion that we follow staff recommendation since Supervisor Madrone didn't. So that's a motion.
We do need a second. Okay, we've got a motion and a second. Any further discussion? Seeing none, Ryan, can you do the roll call vote, please?
Yes, sure. Thank you, Supervisor Bohn. Supervisor Bass?
Yes.
Supervisor Wilson?
Affirmative.
Supervisor Madrone?
Yeehaw, yes.
And Supervisor Fennell?
Yes.
Thank you. Passes 5-0.
Thank you. And thank you very much again, both for the report and also for your work and making sure that the group is solid and following in such a great direction. Thank you. And thanks a lot for sharing your time with us, Carl. And I hope the kids are doing okay now. They seem to have gotten a little quieter. Okay, thanks a lot. Okay, so on we go to our next agenda item. And this is from the Department of Health and Human Services, Behavioral Health, and it's the appointment of 2 board members to serve on the joint service. So what we have is, right now, believe it or not, we, as happens in a number of positions that we oversee, we are actually the governing board, the governing body of Semper Virens, the psychiatric health facility here as the board. So right now we're going to adjourn as the Board of Supervisors and reconvene as the governing body of Semper Virens Psychiatric Health Facility. And as that governing body, now we're going to give a presentation on the appointment of 2 board members to serve on the Joint Conference Committee. So somebody is, I'm not sure who's going to bring this forward, but Connie, it's the Department of Health and Human Services.
Ms. Rogers, I would think.
Okay, let's go with Emmy. Thank you, Emmy.
So, so the governing body structure for SV is laid out in a state and federal regulation, Title 22 of CCR and Title 42 of the Code of Federal Regulations, Section 482, respectfully. Over time, we have had 2 board members assigned, and we are currently just looking at bylaws and reconvening our JCC, which is the Joint Conference Committee for SV, and requesting the appointment by your board of 2 board members to serve on the JCC. I think that Supervisor Bass has perhaps done it in the past, and maybe she can say something about that.
Thank you. Is that all, Emmy? For now? Okay. Supervisor Bass?
Yeah, I was going to say, I believe it was myself and Supervisor Lovelace. And, you know, at the time, it took a while to figure out what we were doing, but it was, realized it's really important. And I've been kind of surprised we haven't. I was thinking when I look at this item, I thought, do we have that anymore? So I actually was glad to see it come forward. So that's not, I don't have a whole lot to add other than I think it was a valuable learning experience for me. And, you know, I'd be willing to do it again as part of one if, you know, if anyone else wants to do it, I'm totally good with that as well. Just want to throw out the offer.
Well, thank you, Supervisor Bassett. Yeah, I was kind of curious about it because I didn't see that we had made appointments to that for years now, and it's not even on our list of committees. So I don't know if at some point we just struck it off, but obviously the interest is there to revitalize it, and appreciate your offer to serve on it. Supervisor Bohn?
I make a motion, we appoint Supervisor Madrone because of his great work he's doing on the Behavioral Health Board. Almost seems like those 2 are married together, and Supervisor Bass with her vast knowledge of the past.
Perfect. Do I have a second? Supervisor Madrone seconds that. Supervisor Madrone.
I'll second that motion and accept the honorable appointment to this subcommittee.
Thank you. Any further discussion? Okay. Is there any public comment on this item? I don't believe there is.
I don't believe there is any.
A motion on the board, on the table. So if you can take the roll call vote, please, Ryan.
Yes, Chair Fennell. Supervisor Bass?
Yes.
Supervisor Wilson?
Yes.
Supervisor Madrone?
Yes.
And Supervisor Fennell?
Yes.
Thank you. Passes 5-0.
And I want to thank Virginia for taking this on, even though I don't know if anyone asked her to. So thanks, Virginia.
Yeah, I
appreciate it.
Like
you said she would.
I am. I will.
I know. I'm just saying, you said you would. I stuck Steve, sorry, but he's on the Behavioral Health Board. Sorry, that was my thinking.
Thank you very, very much, Supervisor Bass and Supervisor Madrone, for stepping up. And I'm glad that you're recreating this, because it seems like it's important with all of the issues that we're discussing today. So that's great. Thank you very much. So we now must add that list, note to the clerk that we want to add that to our list of appointments as we go forward.
Thank you.
Thank you, Emmy. So now we go to, let's see. Let's do one more here, and then maybe take a break before we go to hearings. We'll see how it goes. So our next item on the agenda is updates on the tsunami hazards, inundation, and evacuation. And this comes to us from the Sheriff's Office, but I'm looking now and I do not see the sheriff.
Sure. We have some preventers that I'm bringing into the meeting currently, and they'll be here to present.
Oh, perfect. Thank you so much. I really appreciate it. Oh, I know I recognize a couple of those right there. Let's go with the Director of the Emergency Operations Center, Ryan Derby. Welcome.
Hi, thank you, Chair Fennell. So I'm actually not presenting today, but would like to give a nod to CalOES, the California Geologic Survey, our Redwood Coast Tsunami Working Group, and all the people that helped compile these inundation and evacuation maps. So today we're going to have Jason or Jay Patton, Rick Wilson from California Geological Survey, and Todd Becker from CalOES presenting on the update to these maps. So with that, I'm going to hand it off to them, and looking forward to this update. Thank you.
Thanks, Ryan.
Thank you very much.
Sorry.
No, go ahead, Jay. Welcome.
Thanks, Ryan. Thanks, everyone. First, we'd like to do some introductions, and then I'll present a very brief presentation. So, Rick.
Yeah. Hi, my name's Rick Wilson. I'm a senior engineering geologist with California Geological Survey, and I'm in charge of the tsunami project there at CGS. And we really appreciate the time to present these new maps to you. And I'll go ahead and hand it over to Todd.
All righty.
Welcome, Todd.
Good morning, Estelle. Nice to see you all. Good morning, everybody. Rick and Ryan mentioned, I'm Todd Becker with the California Office of Emergency Services, the Earthquake and Tsunami Program. We really appreciate the board's time today to have us here to discuss the updated tsunami hazard maps. And for a little background, the California Tsunami Program is a program led by the California Office of Emergency Services and also the California Geological Survey. And we work to implement tsunami planning, preparedness, and response activities throughout the state. And one of those key tools in our tsunami planning toolbox is these tsunami hazard zone mapping products that we're here to discuss today. And it's exciting to be here today to discuss this with you guys, because we, the maps we're here to discuss today are the first to be released out of all of California's 20 coastal counties. And that accomplishment is due to the hard work and dedication of people like Ryan at the County of Humboldt Office of Emergency Services, many of the members of the Redwood Coast Tsunami Work Group, and many other local, state, and federal partners on the North Coast that are too many to list today. But on behalf of the California Tsunami Program, we want to extend a big thank you to Humboldt County for their ongoing support to support tsunami preparedness activities for Humboldt's coastal communities. And I just want to make sure to make a note for all the public that may be listening today that now is a great time to check out the updated maps and other resources on tsunami.ca.gov and use this to update your tsunami evacuations plans as needed, especially because many of us are in different working, school, and other situations in these current times. But with that, I'm going to turn it over to Dr. Jay Patton with the California Geological Survey, and he'll provide you some more updated information on the tsunami map updates.
Thanks,
Thank
Todd.
you, Todd.
Oh, sorry, Estelle.
No, go ahead.
I'm Jay Patton. I work with Rick at the California Geological Survey on the tsunami unit. And it's really exciting to be working at CGS because I've been working on tsunami deposits and tsunami hazards in Humboldt County for over 2 decades. So I'm really excited to present here today. So let me share my screen. And can everyone see a slide?
We can just see there you go. Now we can.
Okay, great. So this is just the title slide, and I will move on. If I click, there we go. So just a quick refresher for us who are likely all familiar with this. The Cascadia subduction zone is a convergent plate boundary where the Juan de Fuca and Gorda plates, these oceanic plates on the west, subduct beneath the North America plate to the east. And when the fault is stuck, it causes the crust to buckle and deform vertically, just like when you pull apart a Velcro wallet. When the forces exceed the strength of the fault, it slips during an earthquake, and this causes the crust to move vertically, causing a tsunami. And I'd like to just mention the tsunami can also be caused by other sources like landslides and volcanoes and certain types of weather. And I'll click again. So why are we updating these maps? The maps are being updated statewide because of new information we have learned since the 2009 maps were released. And there is a need to update these maps every 5 to 10 years. And the existing maps are over 10 years old. But overall, better scientific information and tools will make better maps and safer communities. How has the 2011 Japan tsunami influenced the update of the maps in Humboldt County? Well, our evaluation of the experience in Japan indicated that we needed to incorporate new information and more consistency into the map results and make sure that we were at least capturing tsunami events which could occur over a 1,000-year period. So many of you are all familiar with the 100-year flood. So we are incorporating the 1,000-year tsunami in these inundation maps. Have the tsunami hazard or evacuation maps changed dramatically in Humboldt County? The shorter answer is no. There are some minor changes, but overall our existing maps are pretty good. So existing tsunami evacuation plans probably won't need to change, but people need to check that out for their own. For where the maps have changed, we will work with cities and counties to reach out and target the people who live in those areas so that they are informed of these changes and they can update their tsunami evacuation plans appropriately. So do these maps account for local and distant sources? The inundation maps are based on a suite of very large and realistic tsunami scenarios, including both distant and local sources, local being the Cascadia subduction zone. Tsunami inundation maps show where the tsunami science suggests that tsunami waves may flood on land, and the evacuation maps show predetermined areas to be evacuated when a tsunami is expected. So just a few slides showing how in California, we evaluate recent earthquake events, and we check out new tsunami sources that may be responsible for tsunamis that might affect California. And we're especially familiar with the Cascadia subduction zone there in bright blue. Some of the things that have changed is we have better resolution data. So this shows the topographic data used for the 2009 maps. And this shows the topographic data we used for the updated tsunami maps. And something else we noticed is that in some places, the tsunami hazard has changed. So this, this final slide shows the difference between, this is just south of Eureka, the difference between the 2009 inundation map that's in dashed the white line and the 2020 inundation map that's in a red line. And so when we're in a tsunami evacuation or hazard area and we receive an official or a natural tsunami warning like a large earthquake, we use the evacuation maps to help us learn where to go to avoid the harms caused by tsunami waves. Evacuation maps show the tsunami hazard area in one color and the area outside of the hazard area in a different color. So to avoid harm from a tsunami, move outside of the tsunami hazard area. Finally, I just like to highlight, as Todd already did, that we have a whole bunch of new resources available on some new web pages. And particularly, I'd like to highlight the California Tsunami Preparedness Guide, which is our masthead that helps that will help people educate themselves about tsunami hazards and how to use the evacuation and inundation maps that are both online and downloadable at this website. So I'd like to highlight a list of the different partners and open this up for any questions that people might have. So I'm going to stop sharing.
Thank you, Shay. I will say those are amazing graphics. They're really very well done. So thank you for that. Any questions from the board on this item at this time? Any comments? No? So I guess, oh, go ahead, Supervisor Wilson.
It's good to see you, Jay.
Likewise.
Hey, I was just wondering, we're doing so much related to sea level rise and mapping with that. Does this account for sea level rise in sort of the time frame, sort of our planning horizon?
So these maps, that's a great question, and you're not the first person to ask that question. It's important to address sea level rise. These maps will be updated again every 10 years, and over a 10-year period, the sea level rise is very short. But something that you bring up that is also very important is that projects like building construction, that type of a thing, have a longer time life than 10 years, let's say 50 years. And so in the next time that we update these tsunami hazard products, we will be incorporating a projected sea level rise further into the future. So they don't right now, but over the next 10 years, we will be incorporating that.
All right, thanks.
So my question is, you incorporating the 1,000-year scenario, is that what accounted for the further intrusion? And do you get that image from something that happened 1,000 years ago? How do you calculate 1,000 year?
Okay, that's a good, very detailed question. There are lots of things that went into why the resulting maps are different. And one of the biggest changes is that we're using higher resolution topography. And that really helps us learn about where the waves are going to go.
Okay.
The second part of your question is the more complicated part of your question. And I will shorten it, my answer. Basically, if you remember the slide where we saw the whole Pacific Ocean, and there were all those sources around the ocean. So in general, what we've done is that we have taken tsunami models from each of those different faults and modeled the wave from those faults. Then we have assigned, based on the geologic evidence of earthquakes in those areas, we've assigned an estimate of how often those earthquake faults rupture. And then each of those products gets combined into a master inundation map. Do you have anything to add, Rick? You're good? Okay. That
I
was,
love that answer.
okay, great. Me too.
No, that was great. I love it. It's pretty fascinating. You know, it is. And we're learning with it. Thank you. It really is. Had to be fascinating to work on it too, and to continue the work. Any further comments or questions from the board? No? Okay. Any public comment on this item? I don't see any public comment at this time. Nope. Okay. Bring it back to the board. And I don't know if we needed both, but I would just say definitely we want to accept and appreciate this presentation. So maybe I would entertain a motion to accept the presentation.
We do need a motion because there's a resolution attached to the agenda item as well.
That's right. Thank you.
I move that we receive and accept this report and approve the resolution.
Second.
Okay, we have a motion and a second. All those in, oh, sorry. That's
Aye.
back to you, Ryan.
Thank you, Supervisor Bohn. Supervisor Bass?
Yes.
Supervisor Wilson?
Yep.
Supervisor Madrone?
Yes.
And Supervisor Fennell?
Yes.
Thank you. Passes 5-0.
And thank you very much for all of your work. And also, I would encourage people to go take a look on the website. It's really pretty fascinating. Get to know your neighborhood. Thank you, guys. Appreciate it.
Thank you, supervisors.
So, as I said, we have, okay, what's your staying power like? Because we also have a closed session time, but we have a planning and building department hearing. Do you guys want a quick break and come back to the hearing, or do you want to go directly into the hearing and then take the break? How are you doing?
You're the chair, make the call.
All right, thank you.
Take a break.
Okay, let's keep going. Oh, wait a second. Somebody said take a break. All right, let's do this. 15 minutes and we'll be back. Thank you, everybody. We'll see you in 15 minutes. Wonderful. Welcome back, everybody. Now we're going to an item that comes to us from the Planning and Building Department. It's a hearing regarding the Redwoods Rural Health Center General Plan Amendment and Zone Reclassification. So, first of all, I'll have County Council or the Director, I'll have County Council introduce the ordinance, please.
Thank you, Chair. Before your board is an ordinance amending section 311-7 of the Humboldt County Code by reclassifying property in the Garberville area in APN 77-312-009 from residential single family with a manufactured home combining zone to community commercial.
Thank you very much, Councilor Billingsley. So I'm now opening the public hearing and go to Director Ford for staff report.
Good afternoon, Chair Fennell and members of the board. John Ford with the Planning and Building Department. This is really a fairly simple request to allow the Redwood Rural Health Center to expand their facilities by adding parking and medical offices at 59 Shady Grove Lane, immediately adjacent to their existing facilities. In order to allow the conversion of this existing residence to medical office and parking, the property land use and zoning need to be changed from single family residential with a manufactured home combining zone to community commercial with a qualified combining zone. The Q zone is intended to restrict the principally permitted uses to those that are compatible with the adjacent residential uses. So this would meet a critical need in Southern Humboldt in providing medical care. There have been no issues associated with this project. The Planning Commission voted to recommend the board adopt this with a 6-0 vote. And so it's recommended that the Board of Supervisors adopt the mitigated negative declaration, adopt the resolution to amend the general plan land use designation, and adopt the ordinance reclassifying the property from residential single family to community commercial. I'd be happy to answer any questions.
Thank you, Director Ford. Supervisor Bohn.
I was going to make a motion to accept recommendations, but I'll go ahead and wait for. I saw the Planning Commission meeting, and it seemed to go. I mean, it's an upgrade to the community, or we could put in a, so see if there's any public comment, and then I'll make my motion.
Thank you, Supervisor Bohn. Any other input from the board? Okay, I'll open it up to public comment. Do we have anyone interested in addressing this item? And again, I will remind people that you should call the number on your screen and press *9 to be accepted into the queue if you have any comments to make. Again, the numbers are on the screen, and you can press *9 to be in the queue. And I believe we do have at least one public comment on this item. So welcome to that caller. I think you're with number 4313 in your final number.
Hi, this is Terry Clementson with Redwoods Rural Health Center. I just want to say thank you all for your work on the project thus far, and we're excited to plan for the future needs of Redwoods Rural Health Center next door to our medical building.
Thank you, Terry. I really appreciate that. And thank you for your work also. Any further comment on this item? Okay, seeing none, I'll bring it back to the board and close the public hearing. And Supervisor Bohn, back to you.
Again, let's make a motion to accept staff recommendation and introduce ordinance number yada 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 by title and waiver for the reading.
Second.
We have a motion and a second. Thank you to everybody. We'll go to Ryan for the roll call.
Thank you. Yes. Thank you, Supervisor Bohn. Supervisor Bass?
Yes.
Supervisor Wilson?
Yes.
Supervisor Madrone?
Yes.
And Supervisor Fennell?
Yes.
Thank you. Passes
Very
5-0.
Very happy to cast a yes vote on this. This is really going to provide even more service in our rural area. I appreciate the work of everybody, including the Planning Commission before this, the Planning Department, and of course, everybody here. So thank you. And now we have another public hearing before us. And this is the item regarding the All Points Outdoor Incorporated appeal. And this is actually a continuation of the hearing that we had 3 weeks ago. And so now continuing that, if there's any discussion, there is a recommendation that we continue it to September 15th. No discussion on that. All right. I will open it up. Oh, sorry. Go ahead, Supervisor Bohn.
Public comment. Go ahead. I didn't know. I thought we were continuing it.
Yeah. So yeah, we have to definitely have to have public comment. Yeah. Thanks a lot. Okay. So we do have one public commenter. Hi. You are now in the queue to speak.
Estelle, Kent Sawatsky. I guess you had a hearing while I was gone. Can you hear me?
Yes, we can, Kent.
Okay. The video and audio are not in sync here. So you know, you're playing with my understanding a pretty big company. I've recommended before that you don't have to bow to a company, but I highly recommend you get a competent outside attorneys if there's going to be litigation to analyze your risk management for this particular kind of thing. Usually they're in the right. Usually they have top-notch top attorneys and an unlimited budget and unlimited staff. So you always pick your fights on these. Now, of course, you're continuing it, and I'd strongly support continuing it. But in the meantime, I've noticed a real lack of qualified risk management on your litigation and potential litigation, and it's going to be costly and is costly in different processes. So please avoid this one. You're dealing with a very, very large company, and I'm not saying to bow to bullies, but sometimes it's best just not to pick a certain fight with certain people. Thank you for my opportunity to speak. It's my tax dollars that are being spent, and sometimes it's just best not to pick a fight. Bye.
Thank you, Ken. I don't see any further public comment on this item, so bring it back to the board. And again, the recommendation is to continue that, and part of that reason is to address some of the concerns that have been brought up. Correct, Director Ford?
That is correct, Chair Fennell. We're researching the jurisdiction of the State Lands Commission. We're working with Caltrans to establish their permit, and then we also are addressing the potential environmental effects. We've prepared an initial study mitigated negative declaration, and that's currently out for public review.
Thank you. So with that, this hearing is continued to September 15th. Do we need to take a vote on this?
I believe we need a motion.
Yeah, okay.
I move that we continue this item to September 15th.
Second.
There are a motion and a second. And now, Ryan, if you wouldn't mind to do the roll call.
Thank you, Chair Fennell. Supervisor Bohn?
Yes.
Supervisor Bass?
Yes.
Supervisor Wilson?
Yep.
Supervisor Madrone?
Yes.
And Supervisor Fennell?
Yes.
Thank you. Passes.
Thank you. Thank you very much, Director Ford. This brings us to the final item on today's agenda. It's a closed session. So I'll go to Council Billingsley to introduce what we're going to be talking about in closed session.
Thank you, Chair. It's the intention of the board to meet in closed session on 5 items. 4 of them are conference with existing litigation pursuant to Government Code 54956.9D1. The first is Williams versus County of Humboldt, case 119 CV 01330 RMI. The second is Blank versus County of Humboldt, case number 119 CV 3055. The third is Blank versus County of Humboldt et al., case number CV 190389, appeal number A158905. And the last is Blank versus DiMatteo et al., case number DR 190340, appeal number A159219. And the last matter is pursuant to Government Code 54954.5 and 57 to consider a public employee performance evaluation for the position of County Council.
Thank you, Council Billingsley. Is there any public comment on this item? And I believe there is. So, I believe it's Kent. Welcome back, Kent.
Estelle, I just had a question, on this Williams versus Humboldt County. I guess I'll do some research and find out what exactly that particular one is. That interests me. I hope it's not some kind of Amy Gate or something like that. If the county's got involved, it's going to cost, again, us taxpayers a lot of money. So I'll check into that one. Thank you for my opportunity to speak on your closed session items.
Thank you, Kent. I believe there's no further public comment on this, Ryan. So let me ask you, Council Billingsley or CEO Nielsen, how long do you think we'll be in this closed session? I believe it might be something in the neighborhood of 45 minutes. Would that be correct? Do we want to say we'll be back at 1:15?
I think that's a reasonable amount of time.
Okay, so we're going to shoot to be back here at 1:15. Right now we're going into closed session. Thank you. Thank you, Brian. So are we back on?
We're good to go.
Okay, thanks, Ryan. Okay, we're coming back out of closed session. And Councilor Billingsley, anything to report out?
Thank you, Chair. On items L1 through L5, there's no reportable action.
Thank you. Appreciate that. And we are adjourned. Thank you.